next door, but like I've moved community so many times.
There's two of them. So when are we getting out?
We know you're already gone.
Okay, what?
I'm trying to get some good people signals. That's what I'm doing. Like, for me, you saw what I did.
Let me see how my permanent. Oh yeah. It's gonna take a little. Yeah. I mean, if not, like. They want to it's like Thursdays or Fridays. It's like this. I'll get that.
You have that man for
I'll be there for mine.
That's just revenue. You would have already spent probably $2 million.
All right, good evening, everyone. Thank you for joining us. We had a pre-meeting to review the agenda, so I don't think there's any questions about the commissioners or any items on the agenda. So I believe we're ready to begin the introductory video. I'd like to call the May 21st, 2019 meeting of the Buncombe County Commission to order. Thank you all for being with us this evening. Let's begin our meeting with the Pledge of Allegiance. Please rise and join us in the pledge.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This coming Monday, May 27th, is Memorial Day. This is the day that our nation has set aside to honor and remember the men and women who died while in active military service of the United States. There will be a Memorial Day service at the Western North Carolina Veterans Cemetery in Black Mountain on Monday starting at 10 a.m. And that afternoon, there will be a Memorial Day ceremony and concert featuring the Army National Guard's Army Band held on the Roger McGuire Green in downtown Asheville on Monday beginning at 2:30 p.m. The public is invited and welcomed to attend these events along with other events being held in our mountains. Before we begin our meeting this evening, let's have a moment of silence for all the men and women who have died serving our country. Please join us in a moment of silence. Thank you. If you have a cell phone, please turn it off or put it on mute. I'd like to announce that if you use the county parking facility to attend this meeting, you can have your parking validated by one of the officers on the way out. Or if you used Asheville Transit to attend the meeting, you can have your transit ticket also validated. Let me read the ethics reminder to the board. In accordance with the Code of Ethics adopted by the board, all county commissioners have a duty to obey all applicable laws regarding official actions, to uphold the integrity and independence of the office, to avoid impropriety in the exercise of official duties, to faithfully perform the duties of the office, and to conduct the affairs of the governing board in an open and public manner. Is there any item on the agenda, the outcome of which will have a direct, substantial, and readily identifiable financial impact for any board member? Does any board member have a financial interest in any public contract coming before the board today? There being none, all board members have a duty and obligation to vote on any matters acted upon by the board at this meeting. All right, we come to the consent agenda. Is there a motion to approve the consent agenda and to follow the remainder of the agenda as presented?
Second.
All in favor, please say aye. Aye. Any opposed? All right. We've got several presentations, and the first one is going to be about the Asheville Regional Airport, and we have Luke Bleiweiss, the Executive Director, here to provide the update. Luke, good to see you.
Mr. Chairman, thank you. Members of the Commission, appreciate you making time to let me speak tonight, giving you an update on where we are for the last year of the airport operations. I have given you a hard copy of our 2018 annual report. You have it electronically, but you have a hard copy. The annual report basically has to deal with a lot of our team members that work for the authority and what we all are dedicated to do for the community. So we have, for 2018, from an air service perspective, we had 6 carriers: Allegiant Airlines, American, Delta, Elite, Spirit, and United. Allegiant has 41% of the market share. American is 22% of the market share. Delta's 22% of the market share. Elite's 1%. Spirit is 8%, and United is 6%. We added Spirit Airlines in the fall of 2018. The cities we now serve include Newark, LaGuardia, Chicago, Charlotte, Atlanta, Baltimore, Fort Lauderdale, Sanford, Orlando, St. Pete, Tampa, Vero Beach, Denver, and Punta Gorda, Florida. And we just started, announced late last year and just started recently was Philadelphia, Dallas, Fort Worth, Detroit, Washington, Dulles, and Sarasota, Florida. Our passengers were up 19% for the year 2018, which was 1.1 million. And our seats were up 18% for a total of 692,851 seats in the marketplace for the year. Largest increase was Allegiant at 43% of the market share. From an operations perspective, we had 19,370 airline operations, which was up 2.9%. General aviation military was down 11.8% for a total of 41,928 operations. Asheville was named the second fastest growing small hub airport in the country by Bloomberg News. From a construction standpoint, we continue on phase 4 of the runway project. We constructed a new aircraft parking apron adjacent to the terminal building, and we completed a terminal assessment study looking at where we're taking the new terminal or a terminal in the years to come. Part of the infrastructure study had to deal with the new water and sewer systems, and then a terminal building, which we're currently at 113,000 square feet total in the terminal building, and currently we should be around 225,000 square feet with the growth that we've seen. From a community perspective, we entertained and did for the third year in a row Wings for Autism. We honored and did the Blue Ridge Honor Flight. We had a United Way Day of Impact involving a good majority of the airport employees. We had Passenger Appreciation Day, 6 events in all. One was Bojangles coming in on our baggage carousel for arriving passengers, and another was an ice cream sundae social. We did Pause for Passengers, which is our pet therapy dog program, and on Valentine's Day we did Kisses with Pooches, which actually got national attention into major media press. We still continue to do artwork in the terminal, which included WNC Magazine Images of Western North Carolina Photo Contest and student artwork. We continue to be recognized and award-winning for our Music on the Fly program. We sponsored the North Carolina Apple Festival, and we also did Flat Rock Playhouse, to name a few. From a financial standpoint, the airport's sitting in pretty good shape. Our operating revenues for the year were $12.4 million. Our operating expenses were $8.2 million, giving us a $4.2 million fund balance surplus. Our assets at the end of the year were $139 million. That was an increase of approximately $10.1 million from 2017. Combined or contributed to the Western North Carolina, the airport puts in $1.5 billion in economic impact to the Western North Carolina. I'll be happy to answer any questions that the commission may have.
All right, I don't see any additional questions, but just it's a great report, and the things are obviously really thriving at the airport, so congratulations on all the, really, it's a growing area, but the growth of the airport is growing even faster than the just natural population growth in the region. So obviously a lot of good things are happening there, and I know a lot of folks are enjoying a lot of the new connections from Asheville to other cities. So thanks for all of the progress we're seeing.
Thank you. Some of the, we are growing very rapidly. We saw a 59% increase in passenger traffic in the month of March over last March. And so forth for the quarter, we're up 45% over the previous year for the first quarter. So we are knocking out of the park with our community using the airport, and of course, visitors coming to see Asheville and the region.
Well, that's great, and I know we want to encourage all the folks in Asheville, Buncombe County, and Western North Carolina to to look first to flying out of Asheville. It's a virtuous cycle we have. The more folks who use it, the better the pricing, the more connections we have. So the more we use our hometown airport, the better it is for all of us. So we're glad that's happening. We want to encourage everyone to do that whenever possible. Any other comments or questions, Commissioner?
Well, just a question. On the construction of the new runway and the wall being put in, how are we on the time frame of that?
We've had some construction issues over the last 2 years with the contractor we hired. Long story short, we are under another contract now with the bonding company from the defaulted contractor, and we are hoping to have the runway completed by the end of this year, with the remaining of the work being completed next spring. We're being very optimistic about that, but we have to be. Worst case scenario is probably sometime next summer we have it all finished up.
And still on budget, right?
Well, the budget keeps moving, so probably not. The original project, final tally when we got into the last phase was roughly $80 million. Because of the default of the contractor, we're probably looking at about $104 million total for the price, for all the work to be done for the project to be finished. Majority of that is covered by federal grants and user fees of the airport. There are no public tax dollars going into the use of the airport, so we don't have to worry about that. But because of the contract delayed over 2 years, cost of construction is going up. We all know how hard it is to find contractors today. Their prices are getting rather high, so we are incurring about an additional $20 million for the project.
All right, well, if there's no other questions at this time, Mr. Blowers, good to see you. Thanks for the update. Appreciate it.
Thank you, Mr. Chair.
All right, next up, we have an update on the VIA Health quarterly financials, and Clark Phillip, the CFO, is here to help us out with that. Thank you.
Thank you, Chairman, and Commission. Let me introduce a couple of our staff members who are here with me with VIA Health. Brian Ingraham is our Chief Executive Officer. Angela Garner is our County Representative. And Donald Roos is our Senior Director of Provider Operations. Our report consists of about 4 documents. The latest report we sent out was on April the 30th, and it was for the 9 months ended March the 31st. It consists of 4 documents, which is a cover or transmittal letter, a fiscal monitoring report, and I have hard copies if anybody would like a hard copy. Those have already been furnished to the Commission. The fiscal monitoring report, there's an exhibit on the spendable cash, the reality of spendable cash, and then there's a 2-page document regarding comments and explanations. So in the cover letter, we try to explain what's going on with VIA Health, particularly as it relates to the state. And you may have heard some discussion around LMEs and their cash positions. And you may have even heard the statement that the LMEs have $1 billion in cash and are not spending that on services. That is simply a misrepresentation of the reality. In fact, there are several references, both in the general statutes, in our contract with the state, and in reports to the legislative oversight committees that state that those Medicaid risk reserve funds cannot be used for anything other than to pay provider claims in the case of insolvency, and it has to be approved by DHHS. So why is that important? Okay, that's important because it overstates our cash position, it overstates our fund balance, and it overstates the effect on income and losses for the year. So turning to the fiscal monitoring report, which is the second page of the report, there are several sections. There's a revenue section which details the MOE money from the counties. There's an expenditure section. There's also a net income and loss section, as well as a fund balance and a cash position. There are also several columns, which are the prior year budget and actual, and the current year budget, actual, and the balance to be spent. So in the MOE section, how are the funds for Buncombe County spent? So we have a exhibit which shows that the maintenance of effort funds are actually directed by the county on how those are to be spent. And we haven't received the directions for the coming fiscal year, but here's how they were spent in fiscal year 19. $322,000 of it went to RHA services to fund 5 FTEs for jail diversion services for severe behavioral health disorders. And $278,000 went to Homeward Bound to fund 2 FTEs for housing case management, and also for 18 units of housing for the hard-to-house population, and to provide 24/7 security on the premises. So that's how the funds for Buncombe County were spent. If we go on down to the total revenue section, total revenue line, in the actual column year to date, which is column 4, you will see that year-to-date, we've received about $317 million in revenue. And if you go right below that to the next section, you have the total expenditures, which are about $313,000, $313,000 year-to-date. That makes it appear that we've made about $4 million. However, that includes the Medicaid risk reserve funds that we talked about earlier. And if you pull those Medicaid risk reserve funds out, which we cannot touch, we have to keep them in a separate bank account, we cannot use them for any purpose, even for the appropriation to balance the budget. If you pull those almost $5 million out, we've actually lost almost $1 million in the first 9 months. So where are we going to be at the end of the year? Well, at the end of the year, we're going to have about $415 million in revenue, about $431 million in expenses. So we're going to lose about $16 million, not counting Medicaid risk reserve revenue, and if you count that back in, it's a $10 million loss. So that's why it's important to understand the effect of the Medicaid risk reserve. It distorts our financials and makes them look better than they actually are. So what does that do to us on fund balance? Well, we have about $83 million in fund balance, but since $43 million of that is Medicaid risk reserve, and another 20 is restricted by state statutes, that only leaves us about $19 million in unrestricted fund balance. Same thing happens on cash. We have about $99 million in cash at the end of March. When you pull out the $43 million of Medicaid risk reserve, which we can't touch, that leaves us with $56 million in cash. However, if you will look at the next exhibit, which is the expendable cash exhibit, here's why we don't really have as much cash as it looks like we do. First of all, we have, if you take the cash balance of $56 million, and you add back in the things that are owed to us, and you subtract out the things that we have to pay to other people that have already been incurred, that's about $25 million if you take right out of the $56 million. So that leaves us with about $32 million in cash at that point. Now, any prudent business would have on hand at least 30 days worth of cash. For Via Health, since we spend about $1.1 million a day in services and the management of those services, we would have to keep $34 million in cash in reserve. As you can see, once you subtract all of those things out, we're actually in a negative spendable cash position. So that's the kind of the realities of the cash position of not only Via, but all of the other LMEMCs, because they're under this same constraint around Medicaid risk reserve. So I'm going to ask Brian Ingraham to explain how the MOE funds fit into the overall financing of the services.
Well, as you can tell, our financing is a little complex. Before I say anything more about that, I want to be sure to recognize Jim Holland, who has been a fantastic representative for Buncombe County on our board. And I understand you're retiring, Jim, so I'm sure you have mixed feelings about that. We'll miss him greatly, and going to give him a nice send-off at a board meeting in July. But essentially, there's some simple things that I try to represent, and Jim, you've seen this one before, I know. And it really provides some context to how important maintenance of effort funding is and single stream funding. And again, you have to remember that we have responsibility for individuals that both have Medicaid and have no Medicaid or no insurance. And our biggest challenge from a service perspective is meeting the needs of those individuals without insurance. So county support, in the case of Buncombe County, the funding that you provide for services would fit into that non-Medicaid category. So that represents services to people who cannot have services paid for by Medicaid, which is well, as you can see from the chart, there's an enormous discrepancy here. Let me just try to walk you through this. If you look at the blue bar, which is essentially prevalence, and this is a pretty good epidemiologically founded methodology here. It's really just saying, in our population of 23 counties, how many people would benefit from services who have Medicaid? And you see that number around 45,000. And then you see on the other side, the other blue bar, individuals without Medicaid, and about 37,000 people. And over time, these numbers roughly equate. Then you look at the green bar, which is the persons receiving services. Okay, and that's what we refer to as penetration. So we have the prevalence of conditions, we have people's ability to access care. And you see we do very well on that. In fact, one of the things we're most proud of as an LME MCO is that for both Medicaid and non-Medicaid, we have the highest penetration rate of any LME MCO in the state. That means if you look at dollars and services, the ratio of that for us is higher than any other LME MCO. So that's important to know in terms of access. And then the final bar there is money. And you see the huge discrepancy in terms of the amount of funding that exists for the uninsured and the amount of funding that exists for the Medicaid population. And without making any sort of political statement, we're a state that has not expanded Medicaid. And you see that very dramatically reflected here in the challenge of needing care for individuals without Medicaid. The context for this is that all of that maintenance of effort funding is extremely valuable to us in terms of the services that can be provided to that non-Medicaid population. So, that was a whirlwind tour. Be happy to answer any questions.
I just had a question actually going back to the fund balance issue. Could you, we have a lot of interesting internal discussions about fund balance and sort of both the philosophy and sort of practical choices around it. Can you talk about sort of how you all think about that 19 million in unrestricted fund balance in terms of when and how it might be allocated and for what types of purposes?
I should also offer to come back for a work session because that's usually the best venue when we kind of have these conversations because it just gets so complicated so quickly. And not that we don't mind talking and educating, but it's hard in a brief period of time. Over time, that fund balance has been instrumental in terms of the community reinvestment that we've made, which has been probably around $30 million. C3 at 356 is probably one of the best examples here in Buncombe County, and the commitment of probably around $6 million that we made towards that. So over time, we have used that fund balance to reinvest in services until we got to the point where we didn't have enough money to make that reinvestment. And as Clark pointed out, if you look at a real simple cash spendable equation, we're down to about 19 days of cash. So our ability to reinvest in community services and programs has had to stop. We're in negotiation now with the state around our rate and what kind of budget we're going to have for next year. So right now, we're not doing anything with that money. I mean, it's again, if you look at that 30 days of cash as kind of what you want to keep on hand, right now, we can't meet that.
I have a follow-up question to that. In regards to looking at your state funding, I have heard that one of the things on the discussion block is the school-based mental health services that VIA provides. Am I hearing that correctly, that that may not be provided moving forward? Is that miscommunication?
It would, I think, depend exactly what we're talking about. If it is something that is a service that is reimbursed by Medicaid, that's going to be part of our capitation. Okay? Now, we are in the midst of an enormous change that is Medicaid transformation with the creation of standard plans that the commercial insurance companies are going to be offering. And individuals will have an opportunity to either be in a standard plan or a tailored plan. So there might be some mix of things that is confusing people with that. But by and large, for services that are reimbursed by Medicaid, a lot of kids have Medicaid, so generally that's a good population for us to meet the service needs of. There shouldn't be any specific reductions around that. Now, if it is for a program that is not reimbursed by Medicaid, that could be a different situation, just for the reasons I illustrated. But we'd have to kind of go to more specifics about it.
But there could be the possibility that that mental health-based programming in the schools and for our children who are in need could be impacted.
If they were services that are not reimbursed by
That are not
Medicaid, they could.
reimbursed.
And again, we'd have to look at exactly what the services are, and Donald would probably be able to, go right to that.
Yeah, both of our school districts have claimed that that's the #1 need in our schools, so that is a certain concern to hear more about and how that's being communicated and managed moving forward. Thank you.
Let me ask you about a concern I have, period. When I look at your numbers and all, and what you're facing from nationally and the state, how long will you be around? I mean,
Yeah.
I don't see a model that can survive.
Well, that's a great question. We aim to be around for a good long while. We're going to have to evolve as we have successfully. One of the things I'm very proud of, and I hope Jim shares in this, is the ability of our organization over time to be very resilient and to evolve. Our next challenge as part of Medicaid transformation will be to evolve to be a contractor for tailored plans, which will deal with whole person care, and by that I mean an individual's physical health needs as well as their specialty care needs, behavioral health and IDD. Changing from a company that now just deals with specialty care to one that deals with a very focused, high-intensity group for whole person care. We're in the midst of making that transition. And, the money issue is one where, you really, as Clark said, this is a challenge all across the state in terms of the public model that the state has invested in for about 10 years around LME MCOs. And is the state going to continue to support that model? That's really the question. In terms of legislation, we have the opportunity to go forward and evolve our business, but we have to remain viable financially. So, we're not looking for bake sales and car washes yet, but we also recognize that we have to adjust our business model. Always, we're downstream of the General Assembly and the state budget. And our challenge is always to adapt to that. And it becomes increasingly difficult when we face these kinds of reductions. Good question.
All right. Not seeing any other questions, so thank you very much to all of you for being here tonight and giving us an update and answering some of the questions.
Thank you.
Thanks for your work. Before we go to the next item, I'm been remiss. I wanted to acknowledge we've got Sheriff Quentin Miller here this evening. Sheriff Miller, thanks. It's always good to see you. Thanks for being with us. All right. The next update is on the opioid issue, and Rachel Nygaard is going to present this item.
Good evening.
Hey.
I was together with the Board of Commissioners earlier today, working on a conversation around strategic partnership grants. My name is Rachel Nygaard, and I am our Strategic Partnerships Director. One of the things that I support in that role is investments of county funds or investments that we pull in from outside sources in the county's priorities. And I also have the opportunity to support collaborations across our many departments and with our community stakeholders on top policy issues. So tonight is an opioid update. And this was added to the agenda really as a request from commissioners who wanted to hear more about some of the latest efforts within opioids and our response to this. And we thought it would be helpful to pan out a little bit and offer some framing. So we're providing this presentation to you in 3 parts. I will try to keep it brief and get out of the way so that our departments that are working more closely on a day-to-day basis can spend time talking with you. So I'll provide some background, a reminder of kind of what we were looking at when we prioritized opioids, what we're seeing just in terms of current need, and what the county's response in general has been. And then pass to Amy Upham, who's representing public health within Buncombe County's Health and Human Services Department, who will then pass, after covering the emergency overdose grant and the work that public health is doing, she'll pass to Sarah Gayton, who's representing the Sheriff's Office this evening, and they will talk. Commissioner Beachfar had given an introduction to an issue at a recent pre-meeting, which is MAT, the medication-assisted treatment, and the exploratory work that is occurring to look at implementing that within the detention facility setting. As a reminder, we've got 6 strategic priorities as a county, and these were established in December of 2017. And opioids, at that time, we were really seeing a lot of increases here locally as well as across the nation in the extreme outcome that this substance use disorder was having in our communities, including fatal overdoses and fatal overdoses, and we'll look at some of that data in a minute. I dropped in some of the slides from those early days, and at that time, even though it wasn't very long ago, there was a lot of education that we were doing about what exactly is this, what do we mean by opioids, and I think that the community awareness around opioids has really increased a lot over that time, but as a reminder, we're looking at things that are both prescription painkillers as well as illegal or illicit opioid-based drugs like heroin and fentanyl. One of the reasons that this epidemic has been so severe is how dependent people can become very quickly. The potency of these substances is extreme. We have a lot of resources available to us as a county through the state's, the North Carolina Injury and Violence Prevention Branch, which is within Health and Human Services, and they make available slides for communities, and the next few you'll see their logo at the bottom. We've pulled these statistics in. We have some information on the oncoming slides as well that's Buncombe specific, but going back, over 6 North Carolinians died each day from unintentional medication or drug overdose. So this remains an extreme distance from it. One of the data points that we looked at previously was the prescribing rates in the community, and found pretty alarming prescribing rates. You might remember hearing the statistic around almost 68 pills for every man, woman, and child in Buncombe County. The good news is that those prescribing rates are going down. Maybe some of the work that we're doing is contributing to that, and the work of our community partners around educating patients and consumers, as well as providing more resources to people within the medical community. But overdoses from the illicit medications have continued to rise, and a lot of that is due to potency.
Rachel, I have a question. Go back to the previous slide. So that's I feel like this is one of the maybe like the most important metric, right? Like how many of these really addictive pills are just flowing into the community, right? Because we know that a lot of them will end up, leading to a lot of people getting addicted to them. So that's that's positive news, right?
Yes.
But it's still probably way off from where it should be.
It's hard to know exactly.
So that's my question is, do we know, like if things were being done right, like no one's saying there shouldn't be any prescription painkillers used, there's a place for them, but 14 million, so instead of it's 68 pills for every man, woman, and child, now it's 50-something, right? That still seems way too high, of course, right? So what's the right number?
I wouldn't begin to be able to know what the right number is. We know that there was an oversupply based on looking at trends that were not just here but across the country around these prescribing practices. And part of that is so system-wide that it led to us having grounds to enter into the lawsuit that I'll talk about in a minute. So we'll see these numbers come down, but in terms of what's the new baseline and will it go down and overcorrect as some kind of trends do when we look at over at the community population level over time. And luckily, we've got the support of researchers from within, not just here locally in our health department, but the state HHS and CDC who are studying this. And so I'll take that back and let that be something that we follow up on. But it's hard to talk about opioids without talking about fentanyl. That is the real driver around the fatality related to opioids. This is one of those staggering slides when you see a curve looking like that. Somewhere around 2014, that dark blue line, which ends up at the top, takes a dramatic rise upward. The rise in illicit opioids is drastic and has been since 2014. And that was state level data. This is also state level data. This is one of the statistics that sticks out in people's minds, that in North Carolina, you're more likely to die from an opioid overdose than a car accident. Motor vehicle death rates have been declining, and opioid overdoses have been on the rise, or poisoning overdose. In Buncombe County specifically, we can look at overdose deaths, and that is the data that's in that first bullet. Went from 38 in 2015 to 92 in 2017. Those are lagging indicators, so it takes a little time to get that information back. 2017 is the most current information that we have. So one thing that we can look at that's more current is overdose visits to emergency departments. And so that's not fatal, those are visits. And it went year over year, comparing March 2018 to March 2019, from 67 to 87. So on the rise. We are a hotspot in the state. This map demonstrates, again, from the North Carolina opioid dashboard that's available online. This demonstrates emergency department visits specific to heroin and synthetics. Another population or community level thing that we look at is communicable diseases that are correlated, infections that are correlated with injection drug use. The top three are those reportable infections that we can get good data from, because all providers are reporting this and that information gets correlated, but we're also seeing rises in some of these other infections on the list. The chart shows rises in, Dr. Mullendorf should be the one describing this, but on her behalf, invasive group A streptococcal infection, which is like the bacteria that causes strep throat, but it's a different strain and has a severity that's extreme. It's the one that's the flesh-eating bacteria, colloquially. So those numbers are small, but the rises are alarming. And from a public health perspective, there are things, measures and strategies that we undertake that Amy will talk more about in terms of trying to limit the spread of infectious disease. So, quick tour of our response, which we categorize in 5 areas: public awareness, prevention, treatment and wellness, harm reduction, and accountability. I won't have time to stop at each item on each screen, but just highlighting a couple of things as we go along. The commissioners, the Board of Commissioners was very involved when we first kicked off our opioid work in hosting the town halls and getting together with members of the public, and we had some education campaigns that spun out of this. Like the example that you see on your screen, this is one of those strategies, Chairman, to your question around educating consumers around their options for pain relief. So did you know that the 200 milligrams of ibuprofen and 500 milligrams of acetaminophen can act the same as a painkiller? Education at the provider level and prescriber looks different, but this was an example of something that was geared at patients and parents and coaches and things of that nature. As we engage the faith community and other subsets. Another awareness event you heard about recently was the Youth Opioid Summit, which was in its second year and very successful, coordinated by the Partnership for Substance Free Youth. There are prevention efforts that take many shapes and forms. The interagency planning teams sounds a little boring, but those are lively tables where we get together with stakeholders from all of the other organizations like Via Health and our treatment provider community, our medical practices, and talk about what can we do across systems. So examples of those teams are there's a MAT roundtable that's active, there's a group of a recovery collaborative, a crisis providers group, things of this nature that we're really looking at the cross-system level, because one organization alone or even one system alone isn't sufficient to combat. We have a number of efforts related to treatment and wellness, and we talk about this in various discussions. One that I'll highlight for you is the justice system diversion. We opened the Justice Resource Center over in the courthouse on the 15th floor in October of 2017. Is that accurate? I think so. And we've already served 130 people in the felony drug diversion program, which was a new diversion program. There are criminal justice diversion programs that previously were geared at what we would consider these low-level nonviolent offenses, which often had a cutoff at misdemeanors. But opioid drugs are often charged as felony level because of the schedule of substance that they are. And so we know that these programs could get people linked to opportunities to access wellness and avoid unnecessary involvement with the criminal justice system, and have had good success so far. Moving through quickly, harm reduction continues. As an example, the drug take-back event that was held in April, coordinated with leadership from the Sheriff's Office and also our community partners. There were 9 locations on that drug take-back day that collected about 200 pounds of unused medications. And finally, accountability. A note on the lawsuit. As you may remember, we were the first in North Carolina to file a lawsuit of this nature. It's a federal lawsuit, and it's not class action. The way it's described is a multi-district litigation. There's over 1,000 different jurisdictions, cities and counties that are together on this litigation, and Buncombe County is one of 12 that have participation in the steering committee that works with the litigators. There's a group of firms that are that are working on this case with leadership from Barron and Budd, which was selected by this board. So we haven't heard the status of this lawsuit lately, but it continues, and we're optimistic.
So I've been to 2 of those meetings. I can tell you one of the representing the county with the attorneys. I can tell you one of the reasons you haven't heard anything is there is a very serious gag order on those meetings. It's very serious. It's very serious. And their approach is very aggressive, and but the problem is big enough that it needs that kind of action. So that's one of the reasons why you haven't heard it.
So behind the scenes, it's continuing to advance.
Right, there was just a meeting recently. Right?
Yeah, last week. been to 2
Thanks for
in
adding.
the last 6 months.
We also work to leverage outside funding to the extent possible. Amy, when she comes up, is going to talk about the emergency overdose grant. There is an opportunity to access, with support from our partners at VIA, through the work in a detention facility, some SOR or SOAR, state opioid response funds, to support our local work. And a team of cross-departmental representatives from county staff are looking at right now is their proposal that we could put together for the last one on the list, which is known as COPE. This is the Comprehensive Opioid Abuse Program. It's federal dollars dedicated toward opioid response that come through BJA, which is the Bureau of Justice Assistance. This is where I pass it.
Hello all, my name is Amy Elpham and I am the project coordinator for overdose reduction with the Department of Health. I'm going to just keep talking here. So the emergency overdose grant is a time-limited state grant of about $100,000. It was awarded in October of 2018. It goes till August 31st of 2019. It addresses 4 unmet needs, 4 pretty big unmet needs: community health education, naloxone availability, syringe disposal, and syringe services. So we got up and running really quick with this grant because we had to, but also because it's important. And so one of the things that's been underway now for a few months is community education. As you know, we've been doing community education on prevention for a while, but now we also have a harm reduction training that was put together with 9 different organizations. It's really cool. It's the first time I've ever put together a presentation with that many organizations. They had 45 edits and we included each one of them. So it really is truly owned by the community. We've done a train the trainer, and now there are 5 different organizations that can train on this as well. But we've trained at places like AB Tech and Trinity United Methodist Church and Asheville Poverty Initiative, our Voice, Helpmate. Just a lot of people are seeking this training. We also are training on safe disposal. So we have this ad, the safety is the point, and that's our logo for safe disposal. This has gone up in all 22 buses. It's going to go up also in the Rankin parking deck. And it's been given out as 11 by 17 laminated cards for agencies to put up in their bathrooms or in their windows, if they're having a needle problem, wherever they want to put this up. So that's really exciting. And then we've created a disposal brochure, which just went to print on Friday for communities. It has advice for individuals and for businesses on how to safely dispose of needles, because it's becoming a problem in different areas. We also have updated the Closer website. If y'all remember the Closer website that launched a couple of years ago, we've updated it with more information and also created a safer website on harm reduction with some local resources and information as well. So naloxone training, some of the cities that have faced crises like ours throughout the country in the Appalachian region have done what Dayton, Ohio calls blanket the city with naloxone. And so as part of that strategy, we are making intranasal naloxone available to all Buncombe County social workers if they wish to carry it, because they may come across a situation where they need it. We have also purchased some for the sheriff's office, and we're going to be making the intramuscular version available for individuals who access our syringe services program. We've also helped VIA Health a small bit in distribution of some of their naloxone. And then on top of that, we are training people that we're giving naloxone to, or people who just want that training. So all the staff at 40 Cox are going to be receiving the training, the social workers, of course, and then these community groups. It's part of our community education. The next part of the grant, one of the other prongs, is the disposal plan. So we're about 6 large units. These are these big mailbox kiosks that you can't destroy at all or break into. New York has used them and said the only way that they were ever destroyed was by a plow. So they're pretty indestructible. We've bought 3 of them already, but the plan is for 6 to 8 to really put across the city and potentially county. We're looking at who's going to collect those, so that's why you don't see them up yet. But we do have up, if you've been at 40 Cox or 35 Woodfin in the bathrooms or Pack Library, the bathroom disposal units have gone up. So that's really exciting. And Pack Library, the maintenance man there told me they're using them. And last but not least, syringe service program. So you might have heard syringe exchange. We're calling our syringe services because it's comprehensive. And so this is the CDC model for what is a comprehensive syringe service program. So it should include most, if not all, of these things, and ours will include all. So if we start on the, let's see, it's going to be your left, your top left, the free sterile needles and syringes, safe disposal. So of course we'll collect needles there as well. And one of our big units will be outside of 40 Cox, so people can use it after hours. Referral to mental health services, and then the next one's referral to substance use. So we'll have a peer support specialist staff there from 12 to 4, Monday through Friday, who will do those soft handoffs. She won't be transporting people there necessarily, but just giving them the information so they can access those treatments if they'd like. HIV and hepatitis testing, we do it already at the public health department, so we'll refer people there, and do rapid testing for people who come in day of. We're going to be having condoms, and we've already started a PrEP program. PrEP is pre-exposure prophylaxis for HIV/AIDS. This is for people who are at high risk because of either unprotected sex or injection drug use of contracting HIV/AIDS. And there's a really high success rate with using this if they take that pill every day of them not contracting HIV/AIDS even if they're exposed. Hepatitis A and B vaccination, which we already do, will be extended to these individuals, and then we will have naloxone available to them. So, like I said, many organizations have come together. These are just some of them, the ones I was able to get the logos from. But RHA has been involved, VIA has been involved. We were a part of the Student Summit and helped put that on as well. So just trying to reach out as much as possible to the community and get some of these initiatives off the ground. And I'm going to, any questions before I hand it off? Okay, great. Sarah Gayton is going to talk about the trails.
Good evening, how are you?
Good.
Welcome. So we're very excited that the sheriff is all for implementation of a MAP program in the detention facility. The National Sheriff's Association in October of this past year released a publication speaking to the relevance and the importance of MAP programs in detention facilities. What it does is it identifies that we've got not only the rhetorical captive audience, but we have a population at high readiness for change, who are at higher risk for overdose upon release. People who are getting released from detention prison facilities are 40% higher chance of overdosing than the average population. There's a number of reasons that go into that, but at the end of the day, as quoted here, they are the front lines for treating this epidemic. It's a wonderful opportunity to capitalize on the readiness for change and also the opportunity. To bring some context, published currently, there's only 11 counties in the entire nation that have a documented MAP program. Different facilities have elements of MAP, but nobody has got, or 11 counties have got a fully functioning, robust program. 15 states nationwide have got a fully functioning MAP program. This is including prison systems. It's easier to implement a MAP program in a prison system due to the timeline that individuals are there. They have more comprehensive services. So it's more challenging in the short-term detention facilities. The state leadership identifies that we don't have one county in North Carolina that's got a fully functioning MAP program. So what we intend to do is we intend to expand our offerings because currently our facility has different elements of what a MAP program would offer. We have substance abuse evidence-based treatment. We do provide MAT treatment for pregnant women. We either continue it when they come in, or if they're addicted to opioids, we get them on it. As well as we use medications to safely detox individuals as they're coming into our facility. But we do want to expand this offering to individuals who would benefit from that treatment. One of the challenges in building this program is we have not had any data that will inform what the need is. We know empirically from observation that folks are coming in and they're addicted, but the medical system and our jail system has not tracked that data. And so we're working to establish systems right from the jump to track the individuals who are coming in, identify them early on that they do have an opioid addiction, that they need treatment, find out what services they've had in the past, what would be relevant, and also track them all the way through their time at our facility post-release and their follow-up with treatment thereafter. And we're also working with the county systems and providers to identify how do we track this information on a community level, because the more the entire data can be integrated, the more effective we're going to be able to track our programming and the effectiveness of what we're doing to respond. MAT is considered a best practice standard in the medical community. This is a standard of care. These MAT programming has gone up to the court level in Maine before their state court, identifying that it is a relevant need to provide it to inmates, and so this is on the trend. Buncombe County is doing well to address it in advance before it comes to legal action. The vision of our program, we're wanting to reduce the overdoses that are linked to detainment. So whether that's in the facility or post-release, again, there are 40% higher chances of overdosing upon release. There's a 1-month critical window that individuals are most at risk for overdosing, but even shorter, a 2-week critical window. So upon release, if somebody enters into our program, we're going to be looking to provide case management post-release, ensuring that they get through that 1-month period, and ideally tracking them for 6 months to a year, depending on how resources plan out. We want to lower our jail population and recidivism linked to opioid use, certainly address community safety related to crimes linked to the addiction, and then provide these life stabilization whole person care. Our goals, we're looking to increase the medication that's offered to individuals. Again, right now we provide the medication for pregnant women, so increasing the population that can receive that medication. Identify and diagnose individuals early on. If we're able to identify somebody with the disease of addiction with opioids, we're able to direct them towards treatment interventions, and we're also able to help get them lined up for services upon release. If you have a diagnosis of opioid use disorder, you can access resources more easily upon release. So that's going to be an important factor. That's going to give them a key to access resources upon release. Psychoeducation is going to be a large part of this program, teaching people about the risks and harm reduction and the treatment options. Many individuals who are addicted don't even know about that. They don't know what resources are available. Case management support upon entry, during their detainment, and then post-release, as well as the data mechanisms. What can we do internally and also as a community working together to produce good data? The program's going to unfold in 3 phases. We've already started working on phase 1, again, psychoeducation, identifying, linking individuals to treatment. Phase 2 will be focused on continuing treatment for individuals who come into our facility already on that medication. Currently, only pregnant women continue with the medication. Anybody else who comes in on a MAT is currently put through a detox process, so we'll be looking to either continue them on their medication throughout, or what would we need to do to get them back on a medication prior to release. And then phase 3 is expanding the program offerings, looking at a target population that would be eligible for that medication and starting them and continuing it on. One of the challenges with integrating a program such as this in a short-term facility is the timeline. There's 3 different types of medication. Within each type of medication, there's multiple subgroups. Each subgroup has their own type of form of medication to be administered, and each one with their levels of variables. But timeline is a consistent challenge to get somebody on the med, to track their responsivity to it, to ensure that they're at the right dose. These are really dynamic variables, and because we're a short-term facility, there's very few individuals that we know definitively when they will release. So that will be part of our target population in the phase 3. Who can we control the exit from the detention facility with the medication. It's really important to do this with a very mindful, ethical plan. Otherwise, we're setting people up for harm. We currently do have medical protocols for 2 different medications. Again, folks that are coming in, we have a safe detoxin for the buprenorphine with pregnant female. So this is not a totally new concept to our medical providers. They are equipped, they are competent. They do have that certification already in place to be able to continue this program, which makes the implementation a little bit easier on the system at large. And the MAP program will be integrated into our medical contract. Another complexity with the planning is the multi-systems that we're working to integrate into. So with time, after we get the internal jail pieces established, we'll be working with the other justice-involved collaborations to figure out how we can more effectively use this intervention as a way to support the justice initiatives, particularly around the timelines. How can we collaborate with the diversion courts, with probation, with parole, to increase the effectiveness and the stabilization of the populations that we serve. And certainly a lot of collaboration with our community partners. One of the challenges across the nation, not just unique to us, is the amount of providers in the communities. If we start everybody who's eligible on MAT inside the jail, there might not be enough providers in the community to continue that. So that's a really important variable that on a community level they're working to problem solve. So where are we at now? The state has identified through the Department of Health and Human Services some seed money that they would like to give to Buncombe County to be able to pilot this program and launch it. We're coordinating with VIA to be able to filter through those monies, receive them through the SOAR funding allocation that they already have, and then to pass it down through the jail. So all of those negotiations are dynamic. They're currently in process. We will be able to staff with those monies for the first year initially to provide the case management, the linkage, establish these strong community collaborations. We're currently doing the research and development, continuing to gather the data that we can nationally, regionally, from providers, from any source that we can, because again, there have not been unified data sources, and continuing to build out the development of the program. Working with the system collaborations, integrating into the meetings, and then building out the specifics of the timelines of each one of the phases. So MAT is very unique in that it treats the biological response of addiction. It addresses the disease of addiction and provides a behavioral element along with the medical element, along with the substance abuse treatment. It's an integrated care, and so I'm thrilled that the jail has already got all of these critical pieces in place. Really now it's networking the bigger picture and for this very focused response to the opioid epidemic. And between the research that's coming up in the medical community and the articulate response of the medical professionals, the trend of this is it's going to become a mainstream requirement for facilities as time goes on. So it's exciting to be on the front end of this, and we thank you for your support. Any questions?
Not a question. I'd just like to say thank you to you, Sarah, and the team at the Buncombe County Sheriff's Office for your leadership and vision. As you just said, I think this is where best practices are leading, and in this way and so many others, I feel like Buncombe County's been able to come together and really be proactive in our response to the opioid epidemic. It's certainly very sobering and concerning to see the continued rise in overdose deaths, and inspiring to see throughout this presentation the different ways that I think county staff and sheriff's office staff are being proactive about trying to reach people where they are and get comprehensive services that treat the disease of addiction. So a thank you to everyone involved in these efforts, and thank you for the update. It's been a while since we had such an in-depth discussion, and it's one that I hope can come before us regularly. Just this is an issue that touches so many people's lives in such devastating ways, and our hope is that we can bring hope and opportunity for healing and recovery to more people in the community. So thank you to everyone on the front lines of this for your leadership.
Yeah,
I would, Commissioner.
Ellen Frost and myself went and had 4 events. Ellen Frost and myself went and had 4 events on opioids. We went to Black Mountain. It was a pretty decent event. Then we went to Weaverville. It was very small when it was advertised. Then we went to Fairview, and it's even worse. But then we did go to AB Tech, and at least we had some kids and stuff there. But trying to bring all this forward and bring more money into it and do this and do that, I've looked at it in every way I can. You can only help people that want help. And, I've never seen anything it's like the Narcan. I talked to people today. Do we give Narcan to Buncombe County Ambulance Service to take care of these people? Do we give it to the fire departments to take care of these people that want to kill themselves, and then we bring them back to life? But, that's the thing that we've got to try to figure out.
is I don't want anybody to die. But when these ambulance companies or Buncombe County or whoever is paying the tab to bring somebody back, and then they don't receive anything for it, you know, whether it's fire departments, whether it's Buncombe County, whether it's medic or anybody else, it's you know, it's the jail is the jail. And why we, you know, put people in there, they do stuff bad supposedly. I didn't know we'd just put them in jail because it's a drug addict. But it's, asking for more money from the government is, you know, you get a grant. Well, that grant runs out in 3 years, and then guess what? The local taxpayer is the one that picks up the tab after that. And I'm here to work for the Buncombe County taxpayers. I'm here to work for the old taxpayers that's having to make property tax payments, you know, every day, every month on their property so they can stay in it. So we can come up here and be, you know, whatever, you know, this was put on the agenda. We spent basically 40 minutes on something, and then we've still got to go through our agendas for something to vote on. It was put on it. I asked why it was put on it, because Ellen Frost and myself, she's the one who suggested it, we went and did it, and it worked out to a point decent, and this question's asked. But we can't stand in here and make everybody in this county say, this is what we're going to do. Now, you might not like what I'm saying, and that's okay. But you have to look at the reality. People, you got drug addicts, you got drunks, you got alcoholics, you know, it's plain and simple. We can't change them. We can, you know, I guess everybody's mentally ill, including me, because I'm up here. And it's, I can't see going after more grants to do more, because I've looked at what our budget's going to look like, and it doesn't look good. And here we just want to continuously spend, and spend, put more stuff into effect. And, you know, it's beyond me. You know, why I didn't really want to hear all this is because I know it all already. Some people might not have, but I do. And, you know, if we get to 15 people to watch it, except the ones in the audience, we've done something else good. But that's about where this whole project is. And, you know, I'm not for taking more money for something for 2 years and then it turning into something that the taxpayer has to cover. So let's try to help them, but let's figure out how to do it without doing that, because it's not for the old people to do. It's not, you know, when they're making payments every month, we got about 2,some hundred of them to be able to stay in their home, and we're worried about this. I'm sorry, I apologize, but I'm not for doing this. Thank you. I'm for doing whatever, and I was before, but we're trying to make a plan that I can't see them working. I don't care if it's in the jail, and I don't care if it's wherever it is. You know, all it is diverting money in a different area to try to get people out of jail because they got a problem. And I'm sorry. Thank you.
I would totally disagree with what was just said. So thanks for sharing your perspective. You know, this is one of the hardest issues that we face as a community and a society. But I think to just throw up your hands and say we can't do anything is not the right approach. When we set the opioid issue as one of our top priorities, you know, I really didn't know what can we really do at a local level to make a difference. And I really wasn't sure where it might go, but I think that because of course we want to do education and things like that, but you know, beyond trying to encourage folks to, you know, avoid inadvertently developing an addiction around these really powerful drugs, what are the other things that we can do for folks who have developed this addiction? Because there's a lot of people who have this challenge, and we're not going to stop the pipeline of more folks developing these addictions as much as we would like to. Some of the trends are good, some of the trends are terrible, but we know this is going to be an issue that we're facing for quite a while. But this idea of working with the folks in the sheriff's department and the detention facility around, you know, some really science-based solutions that are showing great promise in helping people who do have this who have developed these addictions is really exciting. So I really applaud everyone for, I think this will become very mainstream, as people have said over time, but it's really exciting that Buncombe County can be on the front lines of this. And I would also say to Commissioner Jasmine Beach Ferrara, in particular, I want to thank you for really continuing to focus our attention and our partners' attention on this potential opportunity. So thanks for everyone who's working on it. Any other questions or comments?
I can always tell when my colleague to my left is getting ready to comment. He does a little sign, stands up like that, he's getting ready to go. Then he looks up. So it's not directed in any direction other than just me commenting on the severity of the problem. And I'd say if I had my way, enough is enough. You know, pastors are affected, children are addicted. I was at a meeting and another commissioner shared with me his son had died. So it's pretty serious stuff. So we all got our opinion now. However, you can study stuff to death, you can stay in programming, you can get, so we should expect and measure for results, and we should reach in all kinds of directions. And so I think that's what we're doing. I think we just measure the results, but it's a very, very serious problem. And my eyes have been open to the extent in the couple meetings that I've went that, you know, unless I'm sick, I'm not gonna miss the next one. Because it's a really big problem. We can be very serious about it. And we should do what we can do. We should do what we can do, but we have to be prudent in the process, and we can do that. And, you know, this has affected my family directly, and it's probably affected everybody in this room. There's probably somebody on your mind and your heart right now that has been affected by it. So. But I appreciate all the information. It's I do though. I would like to see more follow up on what's making a difference. You know, the advertising, did it make a difference? Did we measure it? You know, one of the things that we did, which I would have loved to have seen on a billboard, you know, and different things, and maybe I did see it. Maybe that's why I liked it. Was the Tylenol and the ibuprofen together. That's actually we gave that out at my church. I got copies of it to the church, gave it out. And I would like to see more of that done, because it's a pretty very real simple solution that, you know, tells people to go get rid of everything else that you got because you don't need it. The other thing I'd like to hear is I'd like to hear more discussion about acute pain and chronic pain. Because that's really what separates what you should be using, and I'd like to see more discussion about that as we move forward and look at things. But I can tell you this, Brandon, our attorney in the back, I'm dying to tell you some of the things that we have been exposed to. It is alarming. It is very serious. We don't have enough money to fix it. Sure, but when it comes to the mothers and the children, we should look at what we can do. I'm not for necessarily being the first county to do certain things. Just want to make sure that we've measured it properly, and when we execute it, we measure it and see if it makes a difference.
Okay. I want to commend the staff for a good report. Not only that, but let us know that at least we are doing something, and I feel that we're beginning. Because this is not a problem that's going to go away. And it's a problem that I feel we can't afford not to spend funds to correct. Because if we don't, it's just going to cost us more money as taxpayers. And what still struck me is when we did, Jasmine and I, when we did our first meeting in the community to talk to constituents about different problems, You remember, Jasmine, when the couple walked up to us and I could sense something was wrong. And they had lost their daughter the weekend before. This was on Monday or Tuesday, I don't remember the date. But they had lost their daughter. And when she asked us, what are you going to do to solve this? That hit close to home. Because she said, we've elected you, to represent us. And we have a fiduciary responsibility as commissioners to represent the people of Buncombe County, our constituents. And I know we have different ideas and we come from different places, but this is something as a commissioner. I voted for it, for this to be one of our priorities and where to work for, and I will continue to do that as long as I'm sitting in this seat, because it's something that is going to take a while. But if we don't start, and I feel that we are doing what we need to do, not only locally, but nationally with the lawsuit, we've got to do this. And folks, we cannot afford not to. Because when I look at the figures, how many people we're losing, and I talk to EMS personnel here in the county, and they tell me how many calls they have because of the opioids and all. And these are sick people. We can't afford not to help. And I've seen this all my life, and I still complain that years ago when it was in just the black community in the ghettos of New York, Philadelphia, Chicago, and places like that, if we had done what we should have done as a country, we could have cleaned it up then. What's happened? We let it spread. And now it is a true epidemic. But we've got to do it, and we've got to do it in each county, each city. And it's something that we all as individuals have got to do. And look, I see where we spend a lot of our tax money, but boy, this is one place I won't hesitate spending it. And I'm one of the old people that he's talking about, and I'm for it, that Commissioner Fry talked about. I'm an old man too, as a matter of fact, I'm older than he is. But I'm all for whatever we do, and I don't mind spending my tax money for this, because it's something that we need to do. And I'll tell you, like I said, as long as I'm here, I'm going to push staff, and I'm for it. And I hear from all of our constituents, people in the community, wherever I go, because we all are being affected. And don't tell me you're not, because in every family in this county, we're up against this. And let's be men and women about it and admit it, and we've got to correct it. And the only way we can do it, we got to work together. And sure, it's going to be tough. It's not easy, but it's a problem we've got to deal with, folks, whether we want to or not. And that's what I'm glad to see the staff, and if we can get grants to help, sure. I'd rather see my tax money go to a grant to help do away with the opioids than to fight people in Iran or wherever. But this is something we need to do. We need to spend the money here to solve our problems. I'm through. I'm all right.
Any other comments from Commissioner before we move on to the next slide? All right, Rachel and Amy and Sarah and all the folks who are here this evening, thanks for your great work and thanks for the substantive update. All right. We come down to the FY 2020 budget message, and Jennifer.
Actually, I'm going to present. I think Jennifer's going to drive it.
Okay. Great.
So, thank you for the opportunity to present the fiscal year 2020 recommended budget. The budget process started last fall with the department heads reviewing their operations, capital project.
Yeah.
It is. I'll bring it closer here.
You got to eat it.
The budget process started last fall with the department heads reviewing their operations. The capital projects teams met, and information technology review committees held meetings and submitted submitted a requested budget. Upon my arrival in March, I met with every department head to understand their department requests, met with every commissioner to learn of any particular issues that needed to be addressed. I believe this budget is responsive to the needs expressed, and it provides funding for the commissioner's goals and priorities. The budget is balanced with a tax rate of 52.9 cents, which is flat from fiscal year 2019. As I mentioned, it advances the board's goals and priorities. It provides for 21 positions in various departments. It maintains quality services to our citizens. It provides the ability to continue addressing salary inequities and a living wage for employees. It includes 1.77% cost of living adjustment for employees. The cost of living adjustment is based on the consumer price index rate of inflation for the urban wage earners as of December 31st. This budget continues to include funding to meet the retirement incentive obligations. In December 2017, the board adopted 6 key priorities: affordable housing, diverse community workforce, early childhood education, justice resource support, opioid addiction, which you just heard a presentation and update on, renewable energies. All these priorities are focused to ensure a healthy, safe, thriving, and sustainable community. We have maintained a level of funding for each priority area. However, for the fiscal year 2020 budget, there's an increased investment in affordable housing and early childhood education. Proposed program funding for 2020 investments in affordable housing totals $3.8 million. It includes affordable housing services program, special project funding for Lee Walker Heights redevelopment, partnerships with Mountain Housing Opportunities, and existing programming for Homeward Bound. For 2020 investments in early childhood totaling $3.6 million. This includes new grant funding from the Early Childhood Education and Development Committee, Asheville City Schools local preschool direct services, continued partnerships with Southwestern Child Development, Valley's Child Development Center, Warren Wilson College, Buncombe County Partnership for Children, the YWCA, and Community Action Opportunities. We've continued funding for strategic partnership grants, which we discussed earlier. For 2020, we had allocated $605,680. We would increase that based on the conversation earlier today with a 4.42% increase number. The Isaac Coleman grants are also included. This is the third year of a 3-year commitment, funding level at $500,000. This will be for continued awardees. There will be no new money. This is just continuing that commitment for 3 years. And last, we have $100,000 for the tipping point grants. This cycle will begin in the summer. I am recommending a total of 21 positions in this budget. 6 patrol deputies. In March, you heard the sheriff speak about his Century 21 format that he wants to work with in the jails and in the sheriff's office. On average, we have 12 to 14 patrol deputies now covering about 656 square miles. These new 6 patrol deputies would enable coverage to go to 14 to 16 patrol deputies per shift. I'm also asking for 4 detention officers. This will help the detention staff to evaluate arrestees more comprehensively before entry into the detention facility. The assessment, they will assess for impairment of intoxication, a need for medical attention, or a need for overdose treatment as they bring them into the facility. 9 care coordination staff. Currently, the health department contracts for 2 case management programs. The health department will reabsorb that responsibility, and these positions will be funded by Medicaid dollars. There will be no new county dollars to these 9 positions. I'm recommending 1 position in general services. It will be a HVAC or heating, ventilation, and air conditioning. This is on your desk. This is at your table. The HVAC specialist, this will be funded by a third-party contract that will be eliminated and bring that service in-house. And the last position I'm recommending is assistant county manager position that will assist with daily operations provide alignment, consistency, and support among county departments. The board was proactive, recognizing the need to address employee pay. Therefore, last year, you contracted for a pay and classification study, after which you adjusted the salaries for 92 positions. However, pay equities still remains. I'm recommending the adjustment of a minimum of $15 per hour, full-time and part-time positions, and this is based on a 2080 per-year work schedule. In addition, this budget includes $400,000 to begin addressing pay and compensation inequities throughout the organization. The general fund budget is balanced at $334,517,752. This includes an appropriated fund balance of $12,980,963. We are projected to finish 2019 current fiscal year with an available fund balance of $61.2 million, or 19.4%, which is 13.874 above the 15% policy level. My recommendation of appropriating $12,980,000 for 2020 maintains the fund balance policy, matter of fact, just slightly above the policy level of 15%, and it keeps the tax rate flat at 52.9 cents. Ad valorem property tax accounts for 61.65% of the general fund revenues. The annual growth in the base is projected at $1.6 billion, or 4%, with the sale of Mission Hospital contributing $646 million to that total. The estimated base for fiscal year 2020 is $38.77 billion. Intergovernmental revenues account for 12.97, and this is the next largest contributor to our revenues. This primarily funds health and human services and is expected to grow by 3.15%. Sales tax represents 10.02 of total revenues. With a strong economy, we are anticipating growth of 6.09% for next year. The general fund budget is adopted at the functional level. This table shows the recommended allocation to each function. Overall, the proposed expenditure rate of growth is 3.27% over FY19 amended budget. Education is our largest allocation at 27.08% of the budget, and that totals $90.6 million. Human services at 26.52%, totaling $88.7 million. And public safety at 19.0%, or $63.7 million, rounds out our top three functional areas. I'll go through each functional area in the next few slides, except for the debt function. Debt is the principal and interest payments on existing debt and proposed fiscal year 19 debt issuance. General government function. This houses mostly your administrative function, such as budget and IT, finance, HR, governing body, county manager's office. It represents 14.45%, or $48 million. I am recommending two positions of the 21 we spoke of earlier in this function. One heat and air specialist in the general services department, and one assistant county manager in the county manager's office. Public safety. $63.7 million, or 19% of our budget. This includes school resource officers, emergency management, 911, as well as your traditional departments such as your sheriff's office, detention center, and pretrial services. I am recommending 6 patrol officers and 4 detention officers in this function. Human services, $88.7 million. This is our largest function. It is our second largest function, representing 26.52% of the general fund. With the change in Medicaid transformation that you heard about earlier from VIA, I am recommending that elimination of a third-party contract for care coordination, hiring 9 positions, and bring that service back in-house. There'll be no new county dollars will be needed for these positions. Economic and physical development. At $7.7 million for economic and physical development, This is actually a decrease from prior year. During the current year, the board renegotiated an economic development agreement, resulting in savings. I'm recommending that the board transfer the savings to a special project fund in the current year, so that will be coming to you this year, and transfer those savings to meet future economic development obligations and payments. Without committing new funds in the new 2020 budget, that savings would help pay for the next 3 years of funding for economic development incentive payments.
About how much would that be?
It's about $3 million that we saved for Linamar and all the others that we had. So we would want to put that aside to pay those Linamar. I believe the Linamar obligation is $6 million, our total new contract, and we have $3 million already in hand, so we would want to put that aside.
So the funds would be used to pay for projects that were already, not new future unknown projects, but projects that are here that are, there's future obligations on as they invest and create more.
Yes, the ones that we currently have. Once they meet the obligations, we'll use that fund to pay the obligation.
Thank you.
Yes. Culture and recreation. I'm recommending an investment of $8.5 million for a culture and recreation function. This function includes many of the quality of life services that our citizens have come to expect and enjoy from their county government. Services such as parks, greenways, and our public libraries. The largest component of the general fund, again, is funding for education at approximately $90.6 million. This represents 27.08% of the total general fund. I'm recommending a growth rate of 4.24% to fund the K-12 system as well as AV Tech. Our last function is transfers at $4.9 million or 1.46%. The transfer function accounts for funds that are moved or transferred from the general fund into another fund for a special project or purpose. For example, we would take money from the general fund to fund affordable housing that would be set aside, capital improvement projects, and our transportation system, multi-mobility. As I stated earlier, education is the largest function in the general fund. On May 7th, our last meeting, you heard presentations from our school partners. For the local public school appropriation, the total funded amount allocated to Buncombe County schools determines the allocation shared to go to Asheville City Schools based on average daily membership between the two school systems. Buncombe County requested $70.3 million or 7.68% increase. I'm recommending that each institution receive a 4.24 increase over the FY19 amended budget. This increase was projected as a percent increase the county will have in its unrestricted revenues. I'm recommending this formula as a target to be in a systematic and predictable method that is sustainable. Asheville City Schools requested $14.2 million or a 17.25% increase. I'm recommending a 4.24%, which is in alignment with the estimated ADM share. As with the other school systems, I'm also recommending a 4.24% increase for AV Tech. Included in this budget, I'm recommending funds for capital needs and information technology use. I'm recommending certain projects totaling $7.6 million to be financed with debt proceeds. These include new voting equipment to meet the new decertification statute, a retrofit of the Garrett Creek tunnel to improve public safety communications, various building improvements, and funding a fleet replacement cycle for sheriff's vehicles. If approved, debt payments will begin in 2021, with no debt payments in the upcoming 2020 fiscal year. In addition to debt finance projects, I'm also recommending to fund $1.1 million in pay-as-you-go projects, including the demolition of the Zeugner Center, replacement of the pontoon boat at Lake Julian, and a facility needs assessment at the detention center. I'm recommending several IT projects and IT software that we need for more efficient and effective delivery of service, upgrades to existing systems, and improve cybersecurity. Information technology needs total $479,400. This summary table shows the proposed funding for capital and IT needs. I'm recommending using savings generated from prior capital projects to pay for new capital projects and IT needs. The current capital savings available is $1.6 million. Total savings proposed to be used is $1.58. This will leave a balance of $23,435 of prior capital savings. In addition to setting the tax rate for the county, you set the tax rate for the fire districts. Earlier today, you heard from the 6 districts that are requesting a tax increase. Staff has met with these 6 districts and we reviewed their financial data. We will provide you with a summary to aid your deliberations within the coming weeks. The recommended budget in brief is available online, and your interactive budget explorer allows you to drill down into departments or specific categories. As a reminder, there will be a public hearing at the regular board meeting on June 4th for public input into the recommended budget. I do want to take this time to thank the county staff, the performance management team, the assistant county manager, and a special thank you to the budget team for their work in helping to prepare for this budget recommendation. Thank you.
All right, thank you very much, Ms. Pender. So we will have a public hearing on this, and this is just one step in the process. So are there any initial questions this evening?
We do not know in this budget if the county schools or the city schools or AV Tech will come off the numbers that they were at. So how can we have a budget and we don't have their numbers yet?
This is my recommended budget to you, sir. When they get their numbers from the state, which may not happen until after June 30, we can come back and talk about that, but that will not happen before June 30. That's why there's a placeholder in there at a 4.24% included in this now budget.
And we're cutting it down to 15%, basically, just barely over the 15% threshold. And how are we going to finance next year if we have to use all this money from the fund balance in this year? You know, I don't know how you spend all your savings, then you think you're going to have that much for the upcoming year.
So I've got a comment on this. We land on different sides of this. I think the fund balance is fine, 15%. I like the fact it does sustain a tax cut that we took last year. It does do that. I like giving the schools targets. I like holding them to the accountability. I think it's a good presentation. I did not think we would land here when we started, and so we got some time. I'm glad the fund balance ended up where it is. I think we need to have enough, but we've been down this road before on fund balance, and I think it's enough. I mean, I think we're fine. There are several things, and I guess we'll have opportunities to comment on this some more later. But I appreciate the pay-as-you-go. I think there's a couple broadband things in here that I'll salute the county on, because it gives some families opportunities to go to certain areas and be able to do the homework and things like that, and be able to meet some needs. But I would have liked to have seen it less this year. I think there's some expectations on the sale of the hospital and some of that. I think we thought that might be bigger than what we expected, but it wasn't. So it's kind of where I'm at right now. Pretty decent place.
So if there's any changes that you need to see in the recommended budget, please let us know so we can incorporate them. We heard the one today to include more money for strategic partnerships. We can add that. If there's more that you need for us to do or change between now and the public hearing on the fall, and then after the public hearing. So our plan would be to have adoption on June 18th.
Any other comments for now? Great. You know, I do think, you know, going forward, I would really like for us to move into more of a multi-year kind of financial forecasting. I do think that's a really, you know, very good way to think about this. I mean, there's a lot of uncertainties around state budgets and revenues. It's hard to know with certainty what things are going to look like in the future, but I think for, you know, for Ms. Pender and the staff she's been working with, I mean, to be at where we're at in such a short period of time, I think is very commendable. So thank you very much for where we are at in this process. And I think once we have a full year to work through all this together, kind of looking at these things, you know, even further into the future to do budget planning, I think will be, you know, there'll be a lot more space to work in that context. So, all right, let's keep on rolling. Our next item, residential solid waste franchise collections contract, and Dane Peterson will be presenting this item.
Mr. Chairman, members of the board, good evening. Ready to switch gears and talk trash? This, that one never gets old, I use it. I'll keep it rolling. So this evening, I want to discuss with this board the franchise collections contract and also make a recommendation moving forward with the new contract. We have this evening with us Chip Jennings, who is Regional Vice President for Westboro, and Johnny Lee, who is the Area Manager for the Buncombe County area. And they're here to also co-present and discuss Westboro services. So talking overall or general scope of services, when we talk about the franchise collections contract, this is for the unincorporated areas of Buncombe County, and we're talking specifically residential waste and recycling collections. And currently we're in a subscriber-based system. We have been for the past 10 years, and that will continue with the new contract. That will also be a subscriber-based system, so citizens have the option. They have the option to subscribe to the contractor's services, or we have a lot of folks that enjoy coming out to our facilities as well. They can come to the Buncombe transfer station, Buncombe landfill, and a lot of people enjoy doing that, so they'll still have that option, obviously, to continue doing that. And there are currently 32,000 subscribers in this contract. So, in anticipation for the current contract's expiration this year, December 31st, 2019, we as staff got to work last year on developing an RFP document to go out. And we really looked across the industry. We looked at other municipalities similar to us. We worked to benchmark those collection operations. We also interviewed contractors, haulers that are involved with the daily operations, and just to get an understanding of the best management practices in the industry and incorporate those in the request for proposals. And after receiving approval from this board, we began advertising the RFP on January 18th, 2019, and we established a deadline for proposals March 1st of this year. We also conducted a mandatory pre-bid meeting, and we had good attendance there, and there were 7 firms total that were represented at the pre-bid. And ultimately, there were 2 firms that submitted proposals, and the single technically responsive bid was submitted from Westboro. We established an evaluation committee that was comprised of 6 members. There were Buncombe County staff representation, City of Asheville solid waste staff representation, and also citizen representation. And the individual members of this committee were tasked with evaluating the proposal and scoring the criteria against the RFP information that we had put out. That was very important that we look at the criteria that was put out in the RFP, and that we checked that against the proposal that was submitted. References were also checked, and we ultimately got good general feedback from municipalities that are using Westboro services currently. And it was important to us up front too to incorporate results from the Let's Talk Trash survey. We got a lot of good feedback from citizens, and we had a focus on incorporating that as we evaluated the proposal and looking at services for the future. So with the evaluation committee, we made a recommendation moving forward with negotiations with Waste Pro, and we consulted the Board of Commissioners in April 2nd and April 16th pre-meetings. Then we had a face-to-face meeting with the Waste Pro management team, and we discussed questions that the committee had regarding the proposal that was submitted, regarding services currently and proposed operations. And several of the other key discussion points included customer service and the importance thereof, communication not only with subscribers but with Buncombe County as well, proposed operations, lessons learned, and being in this marketplace for the past 10 years, Waste Pro certainly understands the challenges that this marketplace has, and we certainly feel they are equipped to meet those challenges. The service verification in the field, and also the technology that was proposed. So some of the key contract changes, that there will be obviously changes moving forward with this new contract. We're going to cut the base term of the contract in half, moving from a 10-year contract to a 5-year base term with two-year extension options. Weekly waste collection, that's not going to change. Subscribers will still receive weekly waste collection. The recycling will also remain single stream and commingled, but there is a change in the frequency of collections. That's proposed to move to every other week. So that's a change, but the basis of the service change is moving to a rollout cart system. So that is a contractor provided rollout cart-based system where subscribers are issued a waste container as well as a recycling container. We've got them, I wouldn't say hid, but we have them strategically placed over here. So Waste Pro shared those samples, and Chip will speak a little more to the rollout carts.
So we need to communicate that better, because I did get some comments about, hey, you're going 2 weeks, I can't do it, my dog will go crazy, and all that, and which is true. But it sounds like that's not the case. The only thing that's going to be 2 weeks is going to be recycled, which will not create a problem at all.
That's correct. If we're getting public education out correctly,
Yeah.
and we're talking to the citizens about what should be placed in the recycling container, what should be placed in the waste container,
Yeah.
then trash is going to be picked up weekly. Recycling technically should not be a large issue there.
So I wanted to mention that for the benefit of our media friends that are here, that was something that was a concern with the public. So they need to know that if you are doing a story, just saying. So.
Absolutely. Thank you for that. And we are encouraged by the expansion in automated collections and alternate fuel vehicles that Waste Pro has proposed. That was something that we incentivized in the RFP process, was expanding there. And I feel like that's an increase. When you talk about CNG vehicles, the United States Environmental Protection Agency, they equivalent a new CNG truck replacing a diesel vehicle to planting 600 mature trees every year. So the carbon emissions reduction is substantial. I think it's a positive step in the right direction for us. The $1 million performance bond, that will be required throughout the duration of the contract, where previously that was not available after the second year of the contract. We also have incorporated a liquidated damages schedule that has been built into the contract, and that was previously not there in the existing contract, and we certainly wanted to look to improve accountability measures within the contract. This picture is an example of a collection point and a situation we're seeing a lot in the county when we're talking about a rollout cart-based system. This is not atypical. We're seeing this throughout the county, and as you can see, it's a collection issue. It's an efficiency issue for the Waste Pro folks that are out there picking this up, and it's also safety related. You don't know what's inside those garbage bags, so there's a risk there, and also the obvious environmental issues with mosquitoes, flies, vectors such as that, and windblown litter. another example of a collection point where, it's difficult when you've got a lot of stops in a day as a collection worker to understand, is this a paying subscriber account or not? There's not enough time in the day to go through and identify who is a customer, who's not, by digging through those. So that's another challenge we're seeing in the field. And also, if you'll notice, that's in actually a drainage conveyance area. So that's a issue you try to avoid, is any type of area where bags are collected when it could be inundated with water, drainage conveyance. So speaking of the rollout car system, we feel like that helps address a lot of the issues that we're seeing. This liquidated damages schedule is pulled directly out of the proposed contract, and it's, there's a variety of penalties involved with the specific violation that's happening. 1 to 10 valid misses during one calendar month, $200 per miss. And obviously, with the severity of the violation, the penalty would increase with situations such as that area miss being in the $5,000 per month range. And also at the bottom, you can see the leaking truck or debris leaving the truck while hauling, having a penalty of $1,000 per violation. This was, as I mentioned earlier, this was not in the current contract, and we've incorporated this for accountability measures. We hope we don't ever charge a penalty. That's where we would like to be. But we also know that we need accountability on both sides, and both parties understand that. When we look at the proposed subscriber cost breakdown, the far left column, the green column, is the current contract where the pricing will be at the end of this year, in December. So you look at the basic service being $1,608 with the optional $3.80 cart rental, and that cost is $1,988 total per month currently. And option one, which is the one we're focused on, we've built this contract around, is the rollout cart-based system with waste container, recycling container, weekly trash, every other week recycling, the C&G expansion, and the automated truck expansion. That's $19.21 per month proposed. So the other areas that we asked for pricing in the RFP include the premium service cap. That's a maximum. Not every service, every location is the same. So if it's a long driveway or a situation where the customer wants that upgraded service, then we wanted to know, okay, that would be negotiated based on the distance, the type of vehicle that's used, but we want to know where's the cap. You're not going to be able to charge that. So that's the additional $25 is what that premium service cap speaks to. The bulky waste collection, which is scheduled with the contractor, with Waste Pro, the subscriber would collect that. And those are items such as couches, furniture, that you cannot, without creatively, get into your waste container. So the bulky items that should not go in the regular waste. And then also the bear-proof container, which is the $300 single purchase, and then incorporating that into regular collection. And at this time, I would like to turn it over to Chip and John to discuss Waste Pro services.
Thank you, Dane. Good evening to everyone. I am Chip. This is John. We have that distinction. And I'm going to go ahead and jump right into our presentation. And I really appreciate the opportunity to share a little bit about Waste Pro and clear up maybe some questions that you have about our proposal. A couple of things about our company. We are a large privately held company. We operate in 9 states. We have 71 hauling companies, and we have over 250 municipal contracts currently and growing. So we are a nice sized company, and this aligns itself in what we like to do. Buncombe County is special to us. Buncombe County, this contract was actually the first contract Waste Pro got in the state of North Carolina over 10 years ago. So it's a very special contract, and we hope to continue to grow and develop our relationship with Buncombe As I said, we also invest heavily into the county. So far, we've invested over $19 million in capital for this contract. And we look to invest another $7 million with the new contract that's coming up. Okay, so a lot of equipment, a lot of carts, a big investment on our part. We do consider ourselves active members of the community. I'm a very proud graduate of Leadership Asheville, and we are sustainable partners with Leadership Asheville, and we look to continue to do that. We also like to be involved in other ventures in the community, like the food bank, the Chamber of Commerce, just to mention a few. So we like to be involved in the community, and our slogan really is caring for our communities, because that's what we do. I'll let Johnny speak a little bit about our employee retention.
So, Wakeful offers excellent benefits to include medical, dental, and vision. Also, short and long-term disability. We also offer free access to a physician with 24-hour access. Wakeful also offers 2 bonus structures as an incentive for drivers to remain safe and basically just do the right thing. The one program is a $250 bonus that every employee is entitled to, and that bonus can accumulate up to $2,500, and that's a $250 bonus yearly. And basically, it is a bonus that requires folks to meet certain criteria, and when they do so, that bonus is paid out. There's another bonus that we have. There's a $10,000 driver bonus and a $5,000 helper bonus. This bonus is paid out to drivers after a 3-year period of basically being excellent on the job. No accidents, no injuries, perfect attendance, just a few different criteria that have to be met. Right now, we have one driver that received this $10,000 bonus about a year and a half ago, and we have a helper that is due to receive a $5,000 bonus in July of this year. Career path and development. I have currently 4 supervisors that were previous drivers. We promoted those guys within and allowed them to advance within the company. Quite frankly, Wakeful was a big advocate of that, so am I. I also have 5 drivers that were helpers and have advanced into the driver's seat with CDLs that Wakeful has helped them attain. So those are some things that we offer to our drivers and helpers. We also have a driver trainer center in Atlanta, which we recently opened up. I want to believe it was last October. And every new driver that is hired has to attend this program. It's a 5-day program, a very extensive training program that all of our supervisors have also attended, and quite frankly, everyone has spoken very highly of just what the program brings to the table. And I have folks that have been driving for a long time that actually came back with some new knowledge. So that was great.
Thanks, Johnny. And you know, that driver school, we have a lot of drivers say they're going to go down there and test out, and it doesn't always work out that way. They end up staying for the week, which is a great thing. 20 and 30-year veterans, drivers that have been with some of our competitors for a long time. And they go down to this school and realize that there's some things that they didn't know. So one of these days, I'm going to get down there and see if I can test out. Ding mentioned that we're going to incorporate some CNG vehicles into our fleet. We feel that that's very important. As Ding said, you know, it's great for the community, the environment. Probably the one concern that we have is those trucks are quiet. So, you know, you have a lot of people that like to listen for the trash truck, you know, before they put their trash out. That won't work anymore. If we have CNG vehicles, you're going to have your trash out on time. Some of the new vehicles that we're proposing that we're going to add to our fleet, Like we said, CNG automated trucks. Johnny's going to talk about automation because that's so important for our business. But a couple of diesel rear load trucks and some smaller trucks too, and we'll talk about that later, that enables us to go to those, what we call goat trails out here in the mountains, okay? So Johnny, on the automation?
Yes, sir. So automation is surely the future. I actually started my career in the industry right here in Asheville at a local company that had this contract prior to Waste Pro being awarded the contract. So I've ran many of these routes, basically all of these routes at some point, and I've been on the back of the truck helping out as well. So I've been in many facets of the job. With that being said, automation is surely much easier on the driver and help. Basically, there's no help. We eliminate that position, which when you look at the safety aspect of the job, that's where most of our injuries fall. The guy on the back that steps off and twists his ankle, or the guy that jumps off the truck, jumps into a ditch and breaks his ankle. Those things happen quite often, and we can eliminate that with automated vehicles. Also, the driver is not as fatigued at the end of the day. He rarely gets out. He may have the misfortune to get out and have to move a container that's too close to a mailbox or too close to a car, but overall, the driver will not need to get out. The automated arm doesn't get tired. Where we can physically pick up 700 to 800 stops a day with a two-man crew, the automated truck can probably do 1,200 to 1,300 stops, depending on just how tight the terrain is and how tight the route is. So a lot of benefits to this vehicle. When you talk driver retention, that is a big problem across the nation in the waste industry and within the trucking industry altogether. Drivers are hard to come by now and even harder to keep. So we are looking to actually pay our drivers a little bit more and put them in automated trucks. With that being said, I'm looking for drivers to retire with Waste Pro as opposed to wanting to leave in a year. So we're hoping this is going to work in our favor, and I believe it will.
Yeah, that automation really is important for our business, safety-wise. And unfortunately, while I was in this marketplace, we've had several drivers or helpers struck by drivers, and some very serious injuries. That's not good for anyone. So this is a way that we're able to be more efficient and protect our people. And technology, another important piece, John.
Sure. So we have something that's called the Third Eye Cam system. It is instituted Waste Pro wide. Every vehicle has this system. And quite frankly, it can be used for a number of different things, but quite honestly, Waste Pro uses it mainly to drive safety. We have seen a decline in injuries and accidents in Asheville, maybe not necessarily 100% associated to the added with the Third Eye system, but it surely helps. Drivers are quite different when they get into one of these vehicles. Myself, I've ran routes even as a division manager here in the past, and quite honestly, when I get into one of these vehicles, my demeanor changes, the way I carry myself changes. Commercial drivers are not allowed to talk on the phone while driving, while the vehicle's moving. As a division manager, we get a lot of calls a day. That cuts that out. The phone has to lay by the side, and when you get to where you're going, you can make that call or return a call, but the Third Eye system can be used as service verification, which is a big piece for us. We're going to need to prove whether we've been to a location or not, and we can do that with a timestamp, even with a picture, if need be. So there's a lot of benefits to this system. More importantly, I would say that safety surely reigns. We can use this as a coaching tool with our drivers, and quite frankly, we have a board that we post some of these findings on, and no one wants to be on that board. The board is shamed, and so they do their best to stay off of that board. And quite honestly, this system works in our favor. All in all, it's a good system for us to have.
Thank you, Johnny. And the Third Eye system, just to make sure everyone understands, this is a GPS tracking system, okay? So it tracks everywhere that vehicle goes throughout the course of the day. There's a microphone in the cab of the truck. There's a camera that's in the cab, faces out the front of the vehicle, faces out the rear, faces on the side. So it's recording the entire day. We have the ability that we can live stream. We can look and see what our drivers are doing right at that time. We can go back and pull data. We've had to do that numerous times to say, you know, hey, my trash wasn't out, and we can go back and pull the footage and see if it was out or not. And so there's a very helpful tool, and we look to continue to utilize that. We talked about the carts. I know there's been a lot of discussion about the different offerings that we have. Over here across, you can see the first container is what we call a bear-proof container. That's the one that will be available for purchase. The one right behind it is a standard 96-gallon container. We will offer that for trash and for recycle. And then behind that is a 64-gallon and another 48-gallon size container. So, you know, you have some different offerings there. I encourage you to go take a look at them. You can wheel them around, check out the maneuverability of them. You know, some of the smaller ones may give you an opportunity to put several of them in your garage or something of that nature and take up less space. So hopefully you'll find those to your liking. And we'll also talk a little bit about our transition plan. We want to make sure that we keep things simple. The first thing that's a priority is we need to order trucks and carts as quickly as possible. It does take a good bit of time to get trucks in. Sometimes the lead time on that can be greater than 6 months. So ordering trucks and carts and getting those coming is paramount. Also, we need to evaluate the long lane service, those GO trails that I talked about earlier. And we're planning to get that going right away, 1st of July. In our current contract that we have the ability to charge for the long lanes, but we have elected not to do so for a very long time. That's something that we need to start doing, and we need to make sure that we are consistent and do the right thing with the new contracts. So that's something that we'll be looking to do and communicate with the residents.
Are you still going to be using the smaller trucks to go up some, pick up and then bring down to the bigger trucks, or not? How will the small trucks work?
So in our proposal, what we're looking at, a couple of things. We'll probably keep some of those trucks. We call those our scout trucks. But we're going to go to a smaller packing truck. We've seen some trucks in some of the neighboring communities, like Biltmore Forest. We like the model that they use. They have a smaller packing truck. It looks like it can probably travel up most of the roads. And that would also give us a lot more capacity during the day. The scout trucks that we currently use, they aren't packing trucks, and they pack out very quickly, and then we have to find another truck. So using those other trucks, the newer trucks, will give us an advantage with productivity and efficiency.
Okay.
So, but we also talked about, we got to get the word out and communicate with everyone. We're going to do that in several different ways, through community meetings, social media. We talked about a billboard ad. We've utilized the one on Hendersonville Road before. And last but not least, a very important point of contact for us will be with the actual carts, because when the carts are delivered, that gives us an opportunity to offer a welcome packet with information about the changes in the service and who to contact if you have any questions or concerns. That's all I have. Turn it back over to Dane. Thank you.
Can I ask Chip a question? Chip, I see all the cans and the little blue one in the back.
Yes, sir.
That's probably similar to what my can is, except I've had mine for 30 years and the bottom looks a little bad, but can we purchase these cans?
That's something that I think we could consider, purchasing the cans.
I don't want to spend $3 a month to rent something that I drug one around for 30 years. So,
Well, there is not a rental charge for the cans. That's built into your base price.
Yeah.
So that.
But it's 16.08 where we're at. Now we're going to go to basically $20.
Yes, sir.
And that's figured into the price, or you wouldn't be talking about it.
Correct.
So that's what I'm saying. I can't, it's hard for me to, I roll mine down beside the car and then I roll it back up or I drag it, whatever it calls for. But, you know, when we're coming in at a price, that's a fictitious deal again. $20 is more than $16.08. You know, just because you're furnishing something, and it's like I've talked to Dane, you know, if I can't buy it, I don't want it. And that's, you know, and as he said, there's people that go to the transfer station or the trash dump. I think I can probably do that. I can handle my bag, throw it in my car, and take it. So I just can't see an extra $4 a month. And saying we're not being charged for them, that's the wrong thing to say.
Thank you.
Thank you, John. And, I got a couple more slides. Maybe I can memorize them. There we go. So summarizing some of the things that Chip and Johnny talked about, and some of the things earlier in the presentation. You know, we're looking at gains in collection efficiencies. That's very important, and that also factored into the price. When we look across the industry and look at other municipalities, we feel like we're getting a very good value with this price for subscribers. Excuse me. And we see, you know, certain areas with rural collections like this where it's substantially more to go out and provide these collections. We certainly feel that this remains a cost-effective option for residents and for recycling materials. That's obviously huge for our strategic and sustainability goals long-term. We think we're improving environmental impacts by increasing the number of CNG vehicles, providing safer collection practices for workers. We've hit on that a lot because it's at the top. The safety of our people, our citizens, that is at the top. All subscribers will provide those for rollout folks, and we're incorporating the contractor accountability measures that we discussed earlier. So that is the recommendation before you this evening, is that this board execute a franchise agreement with Waste Pro for a 5-year base term with an effective date of January 1st, 2021. And please note, per Solid Waste Ordinance Section 6245, a franchise collections contract must be approved in 2 consecutive board meetings. So pending decision tonight, this will be heard again June 4th. And we didn't get to the most exciting. I proposed we actually put trash in the bear proof and bring a live bear in to see how that worked, but legal, you know how they did it. Any questions? We'll do our best to address those.
So this is subscriber base, right?
Yes, sir, that's correct.
Can you tell me what the definition is?
Subscriber definition. That's correct, yes. You don't pay if you don't sign up for it, correct.
Can't hear you, Joe.
Didn't turn it on. So subscriber base means if you sign up for it, you pay, right?
Yes, sir.
If you don't sign up for it, you don't pay.
Correct.
So there's an option.
There's an option.
Okay, thanks.
Are there any other questions or comments?
The one I had today is still the same one I had for you. You know, 1608 going to basically $20 or 1980, whatever. It's still $20 anyway, you round it up. And we've had the discussion. I would prefer to purchase, I can. Or if they don't like me purchasing, if they want to pick it up, they just need to cut the cost. Or I'll go back to just like Joe said, I can always take a couple bags of trash to down the transfer station.
Yes, sir. Thank you, Commissioner.
I hate to lose the business to them, but, you know, don't tell me they're not charging for something when they are.
And I think it is important to note there are several thousand subscribers currently that will be paying at the end of this contract a rate that's actually higher than the one that Waste Pro is proposing now. So I think that is important to note that there are a lot of people that elect to use the contractor provided cart currently. And there will be a savings there for those folks. And it ultimately goes towards our goals of the automated collections, having the right containers in the field that we know work with the collection equipment that we talked about. That's the biggest, because some of these containers, they just don't work with these more modern technology collection.
But looking at that trash around the side of that road, now, if you got all them containers, you know, if all them people are paying, look how many containers it's gonna be at the end of that road, totally. Then the second week, you're gonna have double the amount of the containers. You know, I look at these dirt roads in Fairview going up the dirt roads, and that's basically where people they don't take the trucks up. And you do see the bags and stuff at the end of the thing on 74A in a couple of different places. But, you know, how they gonna drag them down this dirt road to get there? No different than my driveway. You know, it's hard for me to get stuff up and down things now. I can pull it up with my hand, drag it uphill or drag it down. And that's the way it is. So, so many tall areas to get into. And, you know, even where I live, it'll be hard in certain areas, but, you know, I think for the time, it's the time. And, you know, I thought we'd come back with a decent deal, but then we've got into the container side of it, and I'm just not, probably not for that.
Are there questions, or is there a motion on the issue?
So I want to make a couple more comments. Can we comment after, or?
Yep.
I want to make a motion to approve contract.
All right, and we need to approve the ordinance as well as the contract, or do we just need to approve the contract? So, this is a motion to approve the ordinance and the associated contract.
Yes.
Okay.
Second.
All right, we have a motion and a second. Other comments?
Yeah, I do want to make some comments. There are some things that I'm disappointed in. I think some you know, people are, but they need information so that we can kind of calm that down. One is that I'm disappointed that a lot of other people didn't compete for it. I think, you know, when you put a contract out, you really kind of expect other people to compete for it, and you know, and there's folks in the community that says, you know, if other people compete for it, there's more accountability, and so on and so forth. So that's some comments I'm getting from our, you know, constituents, that they were disappointed. But the fact is, we put it out there, and Waste Pro had already made a substantial investment in the community, and other, you know, places had not done that, right? Yes. And we're not willing to do that. And so we made sure in the contract that there's teeth in the contract. This contract is totally different than the contract we had before. Is that accurate?
I think that's very accurate.
Absolutely. And there's teeth in it, is something that, you know, we like to say. And I don't think Waste Pro has a problem with that. I think they welcome that. It creates accountability for them. They have performance measures, and they're expected to hit it. And if they don't hit it, then you know, there are charges that can be made. I do want to say though that, you know, a fine is okay, but if somebody, you know, I think if some consumers are not really concerned about Buncombe County getting fine money in. They don't want to pay their bill. If you miss the service, you know, then a lot of folks will say, well, I don't want to pay I shouldn't pay my bill. So I think y'all need to think about that when you're thinking about service. You're thinking about if you run into an issue. The other thing to Mike's comment, I think there is going to be differences. Y'all know that. You know, the gentleman, I'm sorry, Chip, the gentleman to your right, his name?
Johnny.
I'm sorry?
Johnny.
You know, Johnny's been all over this county, and so you know there's a big difference between Biltmore Forest and Reeves Cove and Candler. You know, and when you go to pick up, you guys will make those adjustments. And so I'm okay with that. I will say that from a commissioner standpoint, for what input that I would have, you know, I don't expect y'all to give, and I would not accept any excuses for weather, routes, equipment. I mean, y'all have backup for that. So we just, you know, let the community know that, you know, y'all are standing behind all that. Y'all are going to make sure that it's delivered properly. But I like the contract. I like the teeth that's in it. I think it was well negotiated. I'm disappointed that we didn't have a lot of people apply, but that is what it is. And it is subscriber based, so people can, if they don't want to, if they don't want it, then they don't have to keep it. And I think maybe y'all might want to consider in some of the areas, I'm excited about getting a container. You know, my wife's excited about getting a container. But some people might not be. Some people might want to buy it. You might want to think about that and think about the rate or whatever. But anyhow, that's my comments. I think I got everything in that I made notes on. So.
Great. Let's hear from the public. Are there any members of the public who wish to comment? And then we'll have more discussion with the commission. All right. We're going to hear from Don, and then you can get a second, and then you can go through it. Okay.
Well, I was gonna be real nice. Thank Dane for appointing me to the committee, but he may not be glad he appointed me after tonight. But we'll find out if I ever get on another one. I'm a citizen, I can cut through the BS. Trash, I know. My dad bought the first roll-off cart from Brownie Hyder. Most of you don't even know the history of Brownie Hyder. By the way, it was good to have a citizen on the committee, but we got some problems. You're damn lucky to have a contract for this request for proposals. Because you're right, Joe, no other company's going to invest $15, $18 million and then gamble and have those fines, okay? But what I do think in working with Dane is he's going to work with the company. And when I reference check them, and believe you me, I work with management recruiters, so I never get the person that I'm told to talk to. I reference checked this company with one of their companies, and they said that they are trying very hard now to be proactive rather than reactive. Now, to be proactive requires the county is involved. One time I called the county and asked if I had a problem. You know what I was told? Call the company, we don't know anything about that. The county can't do that anymore. But there's one thing that bugs me about this contract. They only have 54 customers per square mile. Yep, I figured it, folks. And that ain't profitable for a trash company. That's probably why, Mike, they're trying to pick up that extra $3 or $4 a month. They ain't making no money a lot. But it's their first contract they've had in North Carolina. They want to keep it. They want to grow the business. It's down the road where you make the fortune. But bottom line is, if you look at the contract, it says that if you have trash, you can have it picked up if it doesn't go in one of those things over there, if you have a sticker on it. Well, now I propose, and I can't see why the company won't do this, because they can't afford to lose you, Mike. They need that 54 per square mile, and they need more added to it. So why don't they give that customer that lives down a long road a choice of buying the stickers? And I'll be more than glad to tell you where you can get them and the variety you can get, and you can see from those stickers. You can put a sticker on a special bag and charge a special charge if it's something you want to get rid of. You might even be able to get rid of batteries and things like that and really provide a service. And I talked to the sheriff, he'd be willing to let some inmates work with you if it has something good to do with the environment. So we'll find out if they want me on another committee, okay?
Hey, this is public comment, but Don, I want to say thanks for serving on the committee, and just ask one question. Do you, I realize you got some ideas, but the committee recommends approval of this contract. Is that,
Oh, yeah,
is that
you
right?
better sign the damn thing today.
Thank you. All right, yes, ma'am, you can go next.
And there you go.
We can't sign it today. We have to go twice.
Yeah, we do have to vote twice.
Hi,
Good evening, Monica Crace, Inca Candler, new program assistant for Seek Healing, nonprofit in our community helping with the opioid epidemic. Also leadership Asheville graduate as well. Firstly, I apologize for my appearance this evening. Apparently nonprofit work is not always glamorous, so I apologize for the casual. Mr. Fryer, based on your comments, I feel compelled to re-educate our community that addiction does not discriminate. It knows no color, religion, race. Everyone has been affected.
Let me handle. So we're only taking comment. We are going to have a general public comment period in just a couple of minutes.
You got my hopes up. Okay, I'll go sit back down and be quiet.
So just
I
be
apologize.
patient with us. We're very close to it, and we welcome hearing you. We are only commenting on the motion for the solid waste contract. No problem, sorry, I wasn't clear. Yes, sir. Yep, your turn.
I'll wait.
Okay, great. All right, any other comments on the waste pro? Yes, sir. And then Jerry, you can go next after Christian.
I'm Barry Lawson from Curbside Management. We're known in the area as Kirby. We process material for the county, both at their transfer center, their landfill, and through Waste Pro for the residential program. One thing that hasn't been discussed is with your current program and not going with carts, you're having recyclables placed in bags. Bags is the #1 contamination that goes into the recycling program. And right now, if you're not aware, there's a real need for higher quality materials in the recycling program. And this is the largest contributor to contamination in that program. So the second thing is we have implemented a couple programs already in the area where we have made the switch to carts and have seen tremendous success in diversion of recyclables out of the waste stream. And a lot of it's because of the extra capacity that a cart provides. So people will, use a variety of excuses why they're not going to recycle. I don't want to buy the bag. Once I fill my bag up, once I fill my bin up, then I've done my job. But obviously a cart provides extra capacity for residents to continue to meet their needs over a 2-week period. So thank you for your efforts on this.
Thank you. Mr. Rice.
Thank you, Mr. Chairman, members of the board. Back when I first started coming to county convention, I was black-headed, black beard. I was young and I could have handled a garbage bag, I could probably handle the bear that got after that garbage, But as you get older, you learn that you can't do what you used to. Now, I'm gonna tell you a good story. If you ever watch the news about the dogs and the cats and how people love them things, and they grab a hold of them things, and they go down the road and the dog will pull in them, that's the young people I'm talking about. But the old people, you know what happens? They get wrapped around the tree. They get around the bush. And then the dog gets loose. That's what I see coming with these trash bins. When you live in the area that I live in and you got to go down a 300-foot road to the bottom, and that cart's going to get away from you, because the average is 35 pounds in that thing. And you get a lot more than that at Christmas, Thanksgiving. If you're all about health and safety, you need to think about what's going to happen to the majority of these people going down that drive. Now this is real, this ain't no place. I can carry a little bag once in a while. But this cart, it's all you can do to drive that cart. Now what I propose is this company to come up with 4-wheel drives for carts, 4-wheel drive carts. Because in some of these places, you're going to have carts that to hold it back while you're going down that driveway. Because a human being ain't going to hold these carts, not even them over there. They're going to have the kids carrying them down there. Can you imagine what's going to be strode down that driveway? They're going to come crying back to mama, hey, I lost the trash, Now, you might think it's funny, but this is real. There's going to be some serious problems. I can see where some people live on this, incline. They're used to dealing with the city trash, not the county, not the country. They ain't got into the country yet. But when you, in fact, put it into the weather around here, and the conditions, and the power's going off, and all this stuff, yeah, I'm sorry, you're asleep, but just try to listen, okay?
All right, thank you, Mr. Rice. Anybody else? All right, we've got a motion and a second. Further questions or comments from the board?
Yeah. Dan, if we go back to page 8 or slide 8 and 9, the trash on the side of the road there, can we get that back up or?
Hey, yeah, we can get there. It's something out there.
Okay, well. So, I mean, this is what I guess I need to pass on to my constituent. So with the cart, this here, you'll be able to identify whose trash this is if it's not in a cart, right? Well, whose responsibility will that be?
Well,
Waste Pros or the county?
That's one of the biggest benefits with the contractor provided containers, because those are issued to subscribers. So we would understand, okay, the contents within that cart, that is a subscriber paying customer.
But we get down here and we've got 2 carts, but we still got all that trash on the side of the road. What?
It's gonna be a major transition.
Exactly.
And you saw in Waste Pro's slide talking about the bag tags, you know, that's the reason we're doing these things is ultimately to get in a better position with this contract, or to provide a more durable contract. So there will be some transitional bag tags for folks. It's one of those situations, when you talk to other counties and municipalities, it was tough to transition to carts. And the next 6 months, for Buncombe County Solid Waste, for Waste Pro, a bulk of that time is gonna be spent getting out communicating with people and getting understanding out of what the changes are gonna be. So we're working to, you know, obviously make that transition, I'm not gonna say seamless, but as smooth as possible. So those are areas we're gonna have to work with the customers on. Education is the biggest thing on that.
Well, I think go ahead.
That probably explains half of it, but I mean, we got a place like this right here. I know one place in my neighborhood, several miles away, that there's only one paying customer there. Everybody knows who it is. But they have this same sign right here. So, I mean, that's...
So Dane, I think he's asking if there's a paying customer, there's no bag tags on the trash, who would have to pick that up?
Well, ultimately, that would be an education point. That'd be when we would get involved with environmental control, and then that would be getting an understanding of who that waste is. Right now, there's so much volume and collections ongoing, it's difficult to stop and say, okay, you know, go ahead and get this up or see whose this is. So I would say that would be a joint effort with educating the customer. We're not trying to come down because it is a transition, but they need to understand that as paying subscribers, it needs to be in containers or during the transition period have the tags.
Because I know, you know, I don't even know where that is, but it kind of looks like a lot of places around where that someone dumps 2 bags of trash off, and then all of a sudden that becomes a landfill for the next week or 2 weeks. Somebody goes, cleans up, and it starts all over again.
Yeah, somebody's giving Roger a call about a cleanup. That's happening, so.
But it won't be, once we have the cards, which I think is gonna do a lot of good, it will be Waste Pro's responsibility to pick up the trash in the carts. It will not be their responsibility to pick up trash if it's not in a cart, because it's clearly not one of their, or unless it's tagged, because it's clearly not one of their subscribing customers. And it becomes an enforcement issue, an education issue for the county, because someone's dumping trash out there, right?
So there's gonna be tags?
There will be tags at least through the transition period.
Because at Thanksgiving, I can fill up a cart and I'm gonna be stacking some stuff on top of it.
That's a good
or Christmas or different occasions, you know, you may fill that cart up, but you'll be able to tag a bag and sit it on top of it or whatever.
Absolutely.
Okay.
Those occasional or periodic overflows, that would be anticipated.
Thing, I have a 91-year-old neighbor, and you know, she can't really tote any of these out to the front. She does not have that much. Her husband died 3 years ago, going on 4 years ago. I help. I try to do what I can. But if we have tags to put on bags, she puts her stuff in. She has the blue bag. She has her trash bag, white bag, and that's what what we put out. So if we were going to do the stickers like I guess Don, we need to get that in effect too, because these older people she can't really, there's no way she could drag it. Any of them cans, not even that little blue one.
Right.
Yeah.
No, those are for subscribers, period. Chip, do you mind to speak to the backdoor service?
Thanks, Dave. We will provide backdoor service for, those that are not capable of doing that, okay? What we ask for typically is a note from your doctor just stating that, and then we will provide that service for you. Okay. Ma'am? No, that would not be a premium service. The only time that premium service would come into effect would be if we have to have a special vehicle to go down these goat trail to get to you. We would have to charge a premium for that, but for the backdoor service itself, no, there would not be a premium for that. And if you don't mind, just one other thing I need to note, on the long lanes, currently we go a lot of places now that, FedEx, UPS, the Postal Service, they don't go. We go those places, to pick up trash now, so, that is the purpose of the premium service that we want to go for that. Okay. All right, thank you.
Thank you. All right, any other comments from the board, questions? All right, my last comment is, one of the things I like about this, there's a lot of things in this that are just markedly better than the old contract. One of the benefits of the receptacles is going to be that I think the recycling rates are going to be significantly increased, because I think when the city had a very robust recycling program, but when they introduced the carts to their system, the recycling rates went up because of that one change alone very significantly, because it's just so much more convenient for folks. So I think that'll be another positive.
I'm excited about being able to find my lid. No offense, guys. I'm just excited about finding the lid.
Okay, we've got a motion and a second. All in favor of the motion, say aye.
Aye.
Any opposed? And we'll vote again at our next meeting. All right, thank you, gentlemen. Okay. Item is being presented by Matt Cable. It's regarding rates for purchased transportation services provided under the transportation agreement between the County of Buncombe and the City of Asheville.
Good evening, Mr. Chairman and Commissioners. I always feel like I'm at a little bit of a disadvantage when I follow Dane at anything. Most of what I have to say isn't ever very funny. Tonight, I thank you for the opportunity to make this request for your action. The request is associated with our transportation agreement between the county and the City of Asheville. The purposes of that agreement are to allow the City of Asheville to purchase transportation from Buncombe County through the Mountain Mobility System. They purchase ADA complimentary paratransit services from the county. The agreement spells out a rate structure, and what we are proposing is a rate increase for services operated during regular hours of Mountain Mobility service. The existing agreement spells out a $1.30 rate per service mile for that contract. We are proposing to increase that rate for that particular aspect of the service to $1.92. Information about the rate increase has been communicated from county staff to city staff over the last year. We actually started these communications back in June, indicating that the county would be seeking a rate increase from the city. And the reason that we are requesting an increase from the city, which they have incorporated into their proposed budget for FY 2020, is to allow the county to continue to allocate the same amount of general fund dollars to operate Mountain Mobility System without having to increase that transfer from the general fund into the operating fund for transportation. And so this rate would effectively allow that flat contribution from the general fund and would be within the parameters of what's established in the agreement in terms of our rate structure with the city. I'd be happy to answer any questions that you have about the existing rate structure or what the proposed.
All right, thanks, Matt. Any questions or motion? I'll move to approve.
Second.
Are there any members of the public who wish to comment on the motion? All in favor, please say aye. Aye. Any opposed? Thank you. Next up, Fund 100, General Fund Revenues, Excise Tax, Jennifer Barnett will present this item.
Good evening, Chairman and Commissioners. So this is an item that is greater than the $250,000 that other budget amendments are on consent agenda. So this one is in excess of that, so coming before you on new business. This budget amendment is a request to increase the revenues and the expenditures for deed stamp excise tax. The additional revenue for the sale of mission is posted. We've referenced that a few meetings ago, at about $1.2 million. We remit 49% of that to the state as a payment for their share. So primarily as a result of this additional dollar amount received in this fiscal year, we are requesting that we increase the revenues and expenditures to be brought up to actuals and to include projected revenues and expenditures for the remainder of the fiscal year. And we are projecting that dollar amount to increase $985,094.
All right, thank you. Is there a motion to approve the amendment?
So moved.
Are there members of the public who wish to comment on the motion? All in favor, please say aye. Aye. Any opposed? Thank you. All right, we've got some board appointments to go through. So we're going to have your packet on that. So we've got, the first two are the Women's Commission, and we've got two reappointments.
I move approval of Lydia Mae Kyles and Lisa Cook.
All in favor, please say aye.
Aye.
Any opposed? On the homeless initiative, there are 4 reappointments and 2 vacancies.
So were the reappointments.
On this initiative, and the collaboration, would very much like for her to continue serving. So I think that an exception in this case is warranted, but I do just want to look at it here.
Can we do that? Can we make an exception? I don't know.
Can't hear you back here. Turn. He ain't got his mic on.
So Lamar and I were talking about this. I don't know if Heather, if you've been looped in on this before or not, but so the county we've adopted a policy saying people should be residents of the county. It's been out there for a long time. So do we just need to look at that to make sure, can we approve her contingent upon kind of confirming that that it's actually legally permissible to do so? I mean, it's our policy. There's no state regulations or anything on this. And my hope is that we could have a general, this is a general standard, but that we could have variances to them if the county deems that's the right thing to do.
Do we want to do this?
Yeah, I'm kind of thinking that I might retract my motion and just go ahead and approve the 3 reappointments, and then we can figure all this out later. So I'm gonna change my motion, if that's okay, to approve, help me out, Garrett, Kelly, and McMahon. And I'll make that motion, not that I'm against the other person, I think it'd be the cleanest way.
All right, so there's a motion for those 3.
Mm-hmm.
All in favor, please say aye. Aye. Any opposed? So could we just maybe have a poll of the board to just first of all confirm if there is interest in appointing Emily to the board? We would need to kind of check and make sure we're not doing anything that's not permissible from a legal standpoint. But even if, let's just work on the assumption for a minute that it is permissible if the board deems it so. Emily's super qualified. I think they really want someone from Homeward Bound on this initiative. But to me, I think it should be rare that we would make a deviation from it, but I'm open to it just based on her qualifications and long service. But where are other people out of this?
So my question would be, would there not be another person from Homeward?
We asked them that, and I think they said that Emily would be the right person from that organization to be on the board.
So they don't have anybody from Buncombe County?
Well, there's other people in the organization, but just based on her role in the organization, they feel like she's the right person.
I get that. I mean, I don't have any strong feelings against it. I think we should check it.
problem I have with that, we're setting a dangerous precedent when we start letting people who don't live in the county on our boards when we have the policy. Because if we let her, and I'm not knocking, I think she's good, great. But if we start this, where will it stop? That's my question.
Well, I don't think we can do, I just don't think we can do it, but if.
In terms of precedents, the only time I know this occurred was several years ago, a planning board member moved out of the county and we had to remove him from the board.
You know, the way I think about it is, we've had, although I don't know, we could look at that too if we're gonna do a little research on it. You know, we've had policies around not appointing people to more than 2 terms on boards. I think there's many people who have served for more than 2 terms on boards from time to time, you know. And I think that's a really important policy, one I would be very reticent to make exceptions to, but my sense is that it's probably within our power to do this if we think it's the right thing to do. But yeah.
As a staff representative to HIAC, I have some extra information if you'd like to add it. I spoke with Emily in advance of this meeting to find out if there could, if it wasn't either allowable by policy or the preference of the board, would Homeward Bound have another person that they could put on the board? And they have a new director, Meredith Switzer, who has been in the position just very shortly and hadn't been in her position when Emily applied for her reappointment, and she would be the backup.
All right, well, so she would apply. Okay.
So,
All right, if that's the case, I'm
We
happy.
have an application process, so.
Organization needs to.
Excuse me, Mr. Chair. Also want to add a little bit of extra information. This is Asheville Buncombe County Board. It's a joint board. It's housed under Asheville, the city of Asheville. And I think they have made some justifications for having an exception to this situation. So, but we have.
So, but we have to, whoever is appointed has to be jointly appointed. Correct. Okay. Any other comments on this, the board? All right, if they're willing to appoint someone else, I'm happy to go with that. I just think Homeward Bound needs someone there. So I'd say we would invite them.
Yeah.
We would invite her to apply.
Right.
All right, we do have 2 other appointments to this board. And the recommendations from the initiative are with Tim McIler and Amy Hobson.
So who's making those recommendations?
The initiative itself, the members of the initiative made the recommendation. And they think a lot about the different organizations and roles they play. So there's sort of different slots for different, specific perspectives that they want to see at the table.
She's only been in the county for 3 years.
Yeah, the only thing I would do is I would challenge them to, to reach out to some other places in the county for some of their, some of the people on the board, so.
Is there a motion?
Second.
Okay, there's a motion for Tim McIler and Amy Hobson. All in favor, please say aye.
Aye.
Aye. Any opposed? All right, so we still have 1 seat, and we'll see if the Homeward Bound director wants to apply. And if not, we'll go back and we'll consider some of these other applicants. All right. And the last one is the library board, District 2. We have 1 appointment.
So I have a little bit of problem with this one because, there's one recommendation, and all these folks that applied, a lot of times we would interview them. Library board's a pretty big deal, but who's making this recommendation?
Library.
Yes, correct.
Library board.
What did they recommend? Did they recommend one?
Okay, Walt.
How many's
Oh, I missed it.
How many's on the library board? Hey, there he is.
There he is.
Tell us the makeup on the board again, remind us of the makeup on the board.
We have 3 recommendations.
Can't hear you.
Yeah. We have 3, in fact, I should grab my paper, but we have
There are a
3.
total of 9 members on the library.
3 from each district.
3 from each district.
That's right. Okay, so we know that.
Yeah.
There were recommendations. K-Wall was the top choice,
Yes.
was the recommendation. Yes.
No, sorry, not from the board. It was from myself, that we had a review panel, which was comprised of me and 2 of the branch managers from District 2.
Okay, so it's not from the board, it's from the.
Right, sorry.
Okay.
That's the answer.
Ms. Wall is a retired librarian.
She sure
I'm not
is.
sure any of the other applicants
She
have
also-
that experience.
She also had expressed a background in construction of libraries, which is particularly relevant right now as we enter into a phase with the East Library being helpful.
This is one of those boards where everyone's always, like the pool of applicants is ridiculously well qualified, so it's never easy, but, Amanda, were you about to say something?
Yeah, I was going to move to accept K-Wall.
Great.
Second.
All in favor, please say aye.
Aye.
Any opposed? All right, thank you for the clarification. All right, come to general public comment. So, the time limit, so folks are welcome to comment to us about any items, except items that we've already taken public comment on earlier in the agenda. You've got 3 minutes. Please let us know your name and where you live. And we'll start with this gentleman.
Good afternoon. My name's Greg Bohan. I live at 26 Laurel Cove Road in Leicester, North Carolina. I have some pictures, but the picture that the waste pro showed is where I live. I have bought cans, put out for them. We have cleaned it up multiple times. Mr. Presley at the county has cleaned it up 3 times. We have needles, TVs in the creek. They just throw their garbage everywhere. I've been everywhere to try to get help. There's nobody willing to help me about this garbage. We take ours to the county transfer station every Monday, and nobody's willing to help us. This is my last chance, hope, to get some help from somebody, from somewhere. We call the sheriff department, and we just can't get any help. It looks like a landfill at our house, and where we go to church, they say, oh, y'all live on Garbage Road now. So, we're trying to figure out where we can get some help, or what our next move is to try to clean it up. We've spent over $1,000 ourselves buying cans. The big rolling cans, they're there. They just don't use them. They just pull up, got pictures of the people in the vans, just throw it out, and the people in the community laugh about it, and they say they get free garbage. They just pile it up right there, and nobody where I live pays for garbage.
What was the address again, sir?
It's 26 Laurel Cove Road where I live.
Okay. All right.
Yes, sir. But it's, you've seen the pictures, and I have plenty more that's worse than that now. And there's a creek 30 feet away where there's a TV that I drug out of it, where they just pulled up and threw it in. And we have pictures, and we know where all the garbage comes from.
All right. The staff are hearing your concern, and we appreciate it. We appreciate you sharing with us.
We just like something done. We've been dealing with it for a year. We've got dates, but we just can't find nobody that's willing to try to help us. And we're to the end of our road now. So, thank you.
Thank you.
And I'm aware of that.
Turn your mic on.
The county has cleaned that up 3 times, but it just continues on. And I don't think Mr. Bohannon said, but he's got names inside the trash bags of who it is, but no one has done anything about this for a year.
Hi, my name is Roy Harris, and I'm a 36-year resident of Buncombe County, 33-year resident of the city of Asheville. This year I've been walking all over the city of Asheville, and I'm starting to walk out in the county also. And one of the questions I have for the city of Asheville as to county of Buncombe also is, I'm trying to figure out where you spend money in my neighborhood. And I live in what they call the South Side neighborhood, which is basically around the Asheville Middle School. And so someone reminded me that you study in the city, maybe you need to go take a look at the county also, because you pay more taxes to the county. So I'm just trying to figure out here. And one of the things I can readily see is that the Asheville Middle School is within 3 or 4 blocks of my house. So I know where's that money goes. But I'm just trying to figure out where's money spent in my neighborhood. And I'm being dogmatic about the South Side, because the South Side neighborhood is one of those neighborhoods that is being vastly, quickly, almost overwhelmingly basically gentrified. And as I see that happen around me, in fact, one of the stories I'm telling across the state of North Carolina, and probably even in the world, is that I came out of my house about 6 months ago and went down and looked at a home within 1 block of probably my house. And I called and asked what was the listing price of it, and voice calmly says $420,000. I look back and I could see the top of my house, the roof of my house, which I paid $50,000 in 1986. And so I was saying, whoa, something is going on. But I know that the neighborhood is being gentrified. So my one question to the county is, how can I know that what kind of money and where the money is? Because I just want to see it, feel it, taste it, smell it. All of my senses, I just want to be able to see is where the county is spending money in my neighborhood, because we're being gentrified and it's going on. And so that's the one question. Thank you for the budget, and to the new county manager. I'm from the East Coast also, so thank you for coming to the mountains and everything. And so I'm gonna be glad to work with you, and thank you very much.
All right, Ronnie, can I answer one?
Yes.
We normally don't, but I'd like to answer what Roy asked. I was on the city school board when it happened. You wouldn't have the middle school there if it had not been for the commissioners of Buncombe County. That's who approved that, and Isaac Dixon.
Certain school board members are very effective advocates for that project, as I recall. All right, Mr. Rice.
Thank you, Mr. Chairman, member of the board. Well, I've been around long enough to tell you a few other things here. You know, the LME and MCO and all this stuff you heard about opioid today? Well, you know, the state just locked you in $600,000 a year, and that you've been paying that mental health, plus all the other money you put in, which amounts to probably several million dollars. So the state is fixing to screw you again. Don't stick no more money in it. Do like Mr. Price said, cut it off while you can. Help who you can, but be careful about you as commissioner sticking money in it. Because when you do, they're gonna lock you in again. And because they're gonna do away with these MCOs, they're just on a puppet trail tonight, talking about all this. Now, let's go to an issue, 911, I call 911. I've already talked to one of the commissioners up there about this, and it took 2 hours. When I got home, 4 hours, actually the first call went in, 4 hours later, I made a call. And it took them 30 minutes to get out. Then it took another 25 to 30 minutes to process, and then when they got through processing the addict that was there, they took her off the premises, put her in the sheriff's car without searching her bags and all, and left and dropped her off at the store down the road. They did not have a place to take her. Now that's sad. That's really sad. Now, the opioid. I want you to think about how you can fix something, and you need to get your legislators to do this. The doctors are getting kickbacks on the prescriptions that they're writing, and some of them is making more than they're making in their practice. Now, this is nationwide. This ain't just in North Carolina. So if you can do this with your legislators, what I'd recommend, you know what the fines and forfeitures is? The money that's going to Buncombe County schools in the city, they make something like $1.3 million or something like that off fines and forfeitures, maybe more, every year. Why not take and get the legislators to look at taking the kickbacks that the doctors are getting from these prescription drugs and put it into fine and forfeiture money, and that'll knock the doctors in the head right there, and they won't be writing all these prescriptions. Because if you don't cut the line off, they're going to keep writing these prescriptions. And what they're doing right now with Mission Hospital and the new nonprofit, they're increasing from 200% to 400% so they can get more through the emergency room. You know what that's going to do? that's gonna increase more money for the county. Because this money, this $1.5 million or $1 billion ain't gonna last forever. Thank you.
Thank you. Anyone else?
I want you all to put your thinking hats on. Look at your budget. Look at where you're gonna be next year. And see, we got all these wonderful projects. We gotta fight opioids. We gotta build affordable housing. We gotta take care of the schools. We gotta take care of this project. We gotta take care of that project. Just go ahead and raise the tax rate 10 cents. This year. How many of you got the guts to do that? Because you know it's where you're gonna need to be after next year if the economy waffles a little bit. Oh, you're looking at me, I didn't say that. Yeah, I said it. Bite the bullet, go ahead and get to the point where you tax me out of my house, tax me out of my rental houses because I can't rent them because you got affordable housing being built, taking my tax dollars being affordable housing, so I can't rent my houses. Just go ahead and get me to that poor point where I can come to you and say, help me. Throw me out, you're not gonna throw me out of my house, are you? Because that's exactly where we're headed, folks. Has anybody seen what the taxes in New York is now? Anybody seen what the taxes in Asheville are now? Look at it. Yeah, these little houses in Asheville, figure what they're paying just in county and city taxes. It is getting to the point people are leaving New York, and New York is considering taxing people that leave because they're so desperate for money. Mike, you gotta say no sometimes. Period. Because everything I mentioned to you is good. And everything that everybody comes up here, they say, oh, it's wonderful. And I guarantee you next year there'll be another super good project come in from affordable housing. They'll have another 2 or 3, 4 million, another 2, 3, 4 million from you. And they're gonna bring it in here 5 days before they gotta have the answer. You know I'm right, Al. 5 days before the answer. So just go ahead, bite the bullet. I propose you do 10 cents added on the taxes right now. Let's see who votes for it. Election's coming. Let's see who votes for it. Admit it. That way you don't have to worry about all these problems. You can just hand out money to anybody, coming and going. Wouldn't that be nice? Make everybody happy. I'm serious. I'm being very serious. And most of you don't believe that yet. But I'm being serious. Because that's exactly where you're headed, just a little bit at a time. B.
Thank you so much. Yes, sir.
Good evening. My name is Alan Coxey. I am a lifelong resident of Buncombe County. I'm a member of the Buncombe County Bar. I'm also on the Family Treatment Court here in the Buncombe County Courthouse. Wanted to arise to speak today to ask you to maintain funding for the Buncombe County Family Treatment. I was very pleased to hear the opioid briefing that occurred today. Having been an Asheville firefighter for many years, I can tell you I know what it's like to be on the front line of dealing with substance abuse issues, so I encourage you to keep your best efforts going forward. I was pleased to hear the sheriff's presentation on MAT. Our court system has looked very closely at the issue of MAT, and we've come to the same conclusion that Sheriff Miller has, that it is best evidence and best practice, and so we are embracing MAT with the Family Treatment Court as well. Enjoyed hearing Ms. Nygaard's presentation. She pointed out the Adult Treatment Court in Buncombe County, but we have 4 courts. She only mentioned one. We have the Family Treatment Court, which I'm a member on. We have the DWI Court that Judge Keppel handles and works to reduce issues with drinking and driving here in Buncombe County. And we also have the Veterans Treatment Court that Judge Pope has been managing for the last couple of years. would ask the commissioners to consider continuing funding for these very important forward versionary courts, as they really do put a dent in the issues of substance abuse in Buncombe County. I know that the Department of Health and Human Services, and I know that DSS is currently undergoing a treatment philosophy change towards early intervention, as evidenced by the START program. We understand that that shift has to do with family reunification to avoid TPR. But we would ask that you consider that the family treatment court is an early intervener for persons with substance abuse. We focus on parents whose children are in the juvenile courts. We accept any persons who are referred as early as the referral might be, so in that way we are early intervention as well. We also work very hard with the sheriff and the jail to divert people from the Buncombe County Jail. We have 2 to 3 people who regularly come to our courts, and we admit them and work with them on their substance abuse issues per meeting. I did submit a letter last month concerning family treatment court. Each of you have that. Ask you to look back at that. And I would like to just say one thing in closing, since my time is coming up. As a firefighter, I know how important it is to save lives. I think our diversion courts or family courts are lifesavers in the same way that emergency responders are lifesavers. So the courts refer people whose lives are in danger to the family treatment courts. I ask you to continue to fund them and respectfully request funding for the family treatment court. Thank you.
All right, anyone else? All right. Just a couple of announcements. On June 4th at 12 p.m., the county commissioners will hold their pre-meeting at 200 College Street on the first floor conference room. On June 4th at 5 p.m., the commissioners will hold a regular meeting at 200 College Street in room 326. So did we decide that we were keeping things at noon? We had some discussion about it and we moved one. So the general plan is to keep those at noon, or is this sort of an ongoing conversation we're still having?
We're either going to move the 2 that have the wrong presentations from the schools and then from the fire district. So,
Okay.
so we haven't planned to keep them all at that time.
Okay.
We decide.
Okay, well, so this one's at noon, but I think there's some interest in just kind of continuing to think about the timing around that, so we can do that then. All right, and just once again, on Monday, May 27th, at 2:30 p.m., the City of Asheville and Buncombe County are hosting the Asheville-Buncombe Memorial Day ceremony on the Roger McGuire Green in Pack Square Park. And we do not have a need for a closed session this evening, so we are adjourned.